Live on Instagram, live on Facebook, live on Twitch, live on YouTube. There we go. Hi guys, glad you could be here. Fun show tonight. This is the only show I ever repeat every year, and every year it's extremely successful. Talking about the food romance connection, how food affects your love life. And you're going to be amazed. It's not just what you're thinking, the intricacies of the hormone imbalances and the brain chemistry. So I'm going to go pretty deep into this. So it's kind of a lot of fun, and you're going to learn a lot. This is one of the shows where nobody wants to talk about it, but everybody has questions about it. So if you have questions, type them in. And at the breaks, if you're new to this, I do my live show, my radio show all around the world. But when we go to the breaks on the radio show, then I go to you guys. We have a little more one-on-one conversation. And we're going to be live in just a few minutes, a few seconds here, actually. So start typing in your questions. Send them in. We'll try to get to all of them. If we can't, send them to me on the website, and I'll try to answer them for you, okay? drjoe.com. Here we go.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Hey folks, Dr. Joe here. So glad you're there. Good show today. We're going to have a great show today, as a matter of fact. We're talking about the food romance connection, how food affects your love life. And it's very, very convoluted where we're going to go. We're going to go down a rabbit hole today. We're going to be talking about how food affects your brain, how food affects your hormones, how food affects your circulation, how food affects your nervous system. Really important things that you have to understand, because every day in our practices, patients come into us, men and women, and one of the things they check off on their symptom sheet is it's romantic issues. We're trying to keep it clean. It's a family show. Oh, by the way, if you have children, this is probably the only time I'll ever tell you, if you're cool with them listening, I'm cool with them staying, but if you want to avoid some questions maybe you might want to make this an 18 and older show. So if you have kids listening, it's up to you. And again, I'll keep it clean, I promise, but it just might be a little convoluted there for them. So that's your call. So it's really, like I was saying, patients come in every day and they check off on their sheet that there's some romantic issues. And it might be functional, it might be mood swing, it might be moods, it might be fatigue, might be bad breath, it might be digestive issues. And all of these things can put a hamper on your love life. And so we're going to talk about what that all means and what you can do to stop that from happening. Kind of important stuff. So let's assume, we'll start out in a little fantasy world here, that you're going to dinner with your significant other. And so what would you consider a romantic dinner? You think about it and you say, well, let's go to Hollywood here. Hollywood dinner, it's going to be soft music, right? It's going to be candles, there's going to be wine, and the dinner might consist of steak and lobster, maybe a side dish of maybe a vegetable, who knows, maybe not, bread and butter, maybe a cup of coffee. We talk about champagne or wine to go with it. So let's break down what you might consider a romantic dinner. And why, in the traditional Hollywood romantic dinner, oh my gosh, the phones are ringing already, is not what it is. Because you can do it as a romantic dinner, but if you're going to plan on romance after the romantic dinner, may not be a good call. So let's start out with, we're going to have our main course. And the main course might be, let's say, steak and lobster. That sounds like a pretty romantic dinner, or even chicken or any type of animal. That's a heavy protein. Your body only needs 8% of its total caloric intake as protein. Anything beyond 8%, unless you're like an Olympic athlete, then maybe you need 10%. Anything beyond that is wasted. So when you put too much protein into your body has to break down that protein and detoxify it. And the protein has to go through your liver, and then ultimately through your kidneys, and then out. And I'll tell you a little story about a friend of mine. I told this a couple weeks ago, and he was a very heavy-set fella, big man, mountain of a man. And he had diabetes and high blood pressure. I tried desperately to get him to listen to me, and it wouldn't. And so I didn't see him for about 2 or 3 years. And he comes into my office, and he looks like me. I mean, he's probably, 6'1". He's probably 190 pounds, maybe 200 pounds. And I was just amazed. And I said, my gosh, what happened to you? He says, well, it was getting bad, the diabetes and the high blood pressure. So I had my stomach stapled. And now my kidneys are failing. I'm in stage 4 kidney failure, and I'm going to need a kidney transplant. And I said, okay. He says, but the diabetes and the blood pressure are gone. What happened was they put him on a high-protein diet. So they had him eating a lot of steaks and meats and very few fruits or vegetables and nuts and seeds. And all that protein was being broken down in his body. The diabetes already weakened his kidneys, and now he's in kidney failure. So too much protein, not a good idea. Most people, I'm a vegan. I've been a vegan for 32, 33 years now. And people always say to me, where do you get your protein? First question, where do you get your protein? Folks, I'm not starving in protein, trust me. Your body only needs 8%. A carrot is 6%. So if you're going to have a steak dinner, it's going to be a lot of wasted protein that's going to have to be filtered out through your body, and that takes a lot of energy. The number one consumer of energy we have as humans is romance. The number two consumer of energy is digestion. And the hardest thing to digest is animal products. So if you're throwing animal products down your throat, not a good idea. Steak, of course, being one of them. Also, steak and meats will rot in your colon. And when they rot in your colon, they give off gases. Now, when it comes to romance, this may not be something that you find fun. So you want to be careful about what you're putting in your body so it doesn't rot in the colon to produce the gases. It produces bloating. Nobody likes to take their shirt off and have, big fat bloated gut out there. Not a lot of fun. Also, the commercial meats are loaded with steroids, chemicals, hormones, antibiotics, pesticides, herbicides, tranquilizers, genetically modified food, glyphosate, which is a weed killer that we use now on genetically modified foods. All these chemicals are getting into the body. I was talking to a teenager the other day, and it's crazy because we have all these different genders now. And I'm not against this. This is not a political statement. My opinion is that a lot of chemicals are in our society that we didn't have 20, 30, 50 years ago. And I believe that may be having an impact on the hormones in our bodies. From what I know, it is. Okay, so you got to be careful with these hormones because we don't know what's going to happen with them. And if you're eating commercial meats and dairy products, chances are you're putting some unnecessary chemicals into your body. Also, if you're eating saturated fats clump your red blood cells together. When red blood cells clump together, you can't carry oxygen. If you can't carry oxygen, you get tired. And one thing about romance, especially as you get older, if you're going out to a heavy dinner, last thing you want to do is have romance afterwards because you're just exhausted. Why? Trying to digest all this food. And those saturated fats clumping the red blood cells together certainly don't help. When the food rots in your gut, you can get bad breath. Now, if you've ever been around somebody, and we all have, the breath is just horrific. Now, there's usually two things that cause it. Number one is a rotten tooth. And that has a certain smell to it compared to a digestive problem. So if somebody has bad breath and it smells like a toilet, chances are it's a digestive problem. They're either not digesting their food properly, they're eating too much animal products, so the food is rotten in their colon. The gases are given off, get absorbed into your blood system. The gases, the blood gases are then exchanged in your lungs, and that's where you get that rotten breath. So people can brush their teeth all day. The problem isn't coming from their mouth. It's coming from their gut, putting the toxic gases into the blood and then being passed out through the lungs. So when you have somebody who has that rotten breath, maybe it's you got to think, okay, something's wrong with my gut. And in many cases, the stomach is pushed up against the diaphragm. And if the stomach pushes up against the diaphragm, the digestive system spasms. As chiropractors, my team of doctors, we adjust or pull the stomach down away from the diaphragm. And when we do that, now the stomach is relaxed. It's able to break the proteins into the amino acids like the stomach's job is supposed to do. And then it doesn't rot in the colon. And if it doesn't rot in the colon, then you don't have that terrible bad breath. So when you have that horrible bad breath, that's usually where it's coming from. So, all right, folks, got to go to a break. I'm going to open up the phone lines. If you have any healthcare questions, anything, not just food romance, the phone number here is 844-44-Dr.Joe, 844-44-DRJOE. That number, by the way, rings through to my offices when I'm not on the air. We have offices in Marietta, Duluth, and Stockbridge in the Atlanta area. We would love to help you get well and stay well. Folks, I'm Dr. Joe Esposito, my website, drjoe.com. Hey, tell your friends about the show. I'll be right back.
Mythic music there. There you go. All right. Any questions on our social media, folks?
Do you have any questions?
I have nothing yet.
Okay.
I had just one on Instagram that says, how about fruit and cottage cheese?
Okay. Once again, it's a dairy product, which is an animal product. Very hard to digest. So my thought process is I don't eat animal products. I don't eat dairy products. I wouldn't eat cheese. If you're going to eat animal products, and you shouldn't, but if you're going to eat it, I want you to do organic only. And the reason is 20, 30 years ago, we didn't have to worry about steroids, hormones, chemicals, pesticides, herbicides, genetically modified food, and now we do. So if you're going to do animal products of any kind, I'd recommend organic only. However, when it comes to food and romance, I wouldn't do dairy. Because one of the things, even professional models, what don't they do? Before they go on and do a runway, they don't do any dairy and they don't do any wheat. Why? Those things can cause a lot of bloating. And a model has to look real trim. And supposed to look real trim if that's their model, if that's what they're modeling. So dairy products, not a good idea. So there's my answer.
And then we had somebody else that said that they have been defending themselves for years with these facts, and they're happy that you're here to.
I'm glad you're here too.
reinforce.
If you like what you're hearing, go to our website, drjoe.com. We have well over 1,000 hours of podcasts there. So you can tune in, download them, share them with your friends. I'm more than happy to spread the knowledge with whoever you'd like to from our website. Garrett, you're biting your lip. You have something to say, or you just got a
Try not to
itch?
yawn.
I'm trying not to
Am I
yawn.
boring you today? Gosh, I'm sorry.
Okay, I have one more question.
Well, there. Sierra wins. I'm going to give her a bell because she got 3 questions and you got none. So.
Come on, guys, help me out.
Help out, Garrett.
What are the differences in health benefits between alkaline water and hydrogen-infused water?
Here's my thoughts. If you're drinking alkaline water, you drink it to alkalize your system. If you're eating a good diet, you don't have to alkalize your system. Same thing with the hydrogen-infused water. So if you're eating a good diet, you don't need these special waters. So it really is not going to solve the problem. It's going to treat the symptom. It's not going to treat the cause. The cause is getting a good diet, and then you don't need those waters. So that's my thoughts on them. Nothing wrong with them, but you don't need them if you're doing everything right.
What kind of water would you recommend?
I have a filtered water in my house. I have a very large filter. It's about, I don't know, almost as tall as I am, and it filters out every drop of water. I like that because if you have chlorine in your water and the toilet water is releasing chlorine, if you take a shower, your pores open up, you absorb chlorine. I like to filter every drop of water in my house, and then I'm fine drinking it, bathing in it, washing in it, everything. So,
What about your toilet water?
toilet water is also filtered because if it has chlorine in it, it's giving off chlorine gases, even if the toilet's just sitting there. So as long as all the water is filtered, you're in good shape. So Garrett, do you have any questions, or do I have to keep going back to Sierra here? Apparently, she's
Nothing
kicking
yet.
your fanny when it comes to questions here.
I have another one.
So there you go.
Instagram's very active today.
Instagram, I'm going to give Instagram the bells tonight.
How are people living so long on Mountain Dew and McDonald's?
Well, they may not be, okay? Genetics play a role in it, but some people aren't living long on Mountain Dew and McDonald's. And I've never known anyone in my 35 years of seeing patients that live on junk food that don't have healthcare problems. And you got to remember, too, that 20, 30 years ago, we didn't have a lot of the steroids, hormones, chemicals, pesticides, herbicides, and now we do. So this generation is really in deep doo-doo if they don't do something about this. So.
I got another one.
There.
They just keep coming up. Why do patients see chiropractors for so long? Is chiropractic more of a lifelong treatment of adjusting?
I like to have chiropractic maintenance. I think that we're always beating ourselves up. We're always doing something. I mean, you're standing, you're lifting, bending, squatting, housework, yard work. So I think it's a good idea to maintain the spine. But in our offices, we get the patient 3 phases of care. Number 1, get them out of pain. That's usually pretty quick. Number 2, stabilize the spine. Relatively quick, too. And then we put a patient on a maintenance program, which I feel is ideal because we're always doing something stupid to our bodies. It's like saying, well, I'm going to brush my teeth once. I'm not going to do it again. If you never hurt yourself again, you never traumatize your spine, you never need chiropractic care again. But I don't know anyone's ever
attribute it to an oil change for your car.
Exactly.
Every so many thousand miles,
It's a good idea.
you need to have your back worked on.
You need to get a tune-up. I mean, we all do. It just is what it is. Yeah. But that's like saying, well, I go to a dentist. I'm not going to ever go to a dentist again because I'm never going to, I went once and I don't need it again. Okay. Teeth will fall out. And if the bones are out of alignment in the spine, they will deteriorate. You will get arthritis. You will pinch nerves. It will affect the organs. Just is what it is. I mean, I wish I didn't have to get maintenance either. I'm a patient too. You have to do what you got to do.
And the same thing to supplements. If everybody ate,
Best years are behind you, you're wrong. Listen to Dr. Joe Esposito every week on WSB.
Hey folks, Dr. Joe here. So glad you're there. Today we're talking about the food romance connection, how food actually adversely affects or positively affects your romantic life. So we're going to talk a little bit about the bad stuff, and then we're going to talk about the good stuff, the things that you can do to actually enhance your romantic situation in life. And what we're going to talk about is actually how to get healthy. But there's certain things that really are truly aphrodisiacs out there. We're going to talk about those. If you have a healthcare question, lines are open, 844-44-Dr.Joe, 844-44-DRJOE. We started out with if you're going out to a romantic dinner, and let's assume you have a steak. And the steak we talked about how hard it is to digest. It takes a lot of energy. It can rot in the colon. Not a good idea to saturated fats clump your red blood cells together. But also food is, meats especially, are acids. We talk about the 7 acid foods or the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. I know that's everybody's diet, right? But when I talk about alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, those foods, for many reasons, are not good for you. One of the reasons being that they're acid. And when you put acid in your body needs calcium to neutralize the acid. So the body is giving up calcium to neutralize the acids. And the calcium is necessary to help relax your muscles. So here's how romance works in your body from a neurological standpoint. There's two types of nerves in your body. The sympathetic nerves speed you up. Sympathetic SNS speed you up. Parasympathetic slow you down. So you want to go into the parasympathetic mode when it comes to romance. If you're in the sympathetic mode all the time, you're not downshifting into the parasympathetic mode. Calcium helps relax you and put you into the parasympathetic mode. So if you're eating a lot of acid foods, you're using up your calcium stores. And if you're eating a lot of acid foods, chances are you're not eating foods that have a lot of calcium in them, which would be fruits, vegetables, nuts, and seeds. So you got a double whammy, using up your stores and you're not replacing it. So it's really hard to get into that parasympathetic mode when you're in a sympathetic mode. Let's do a little bit more on neurology here. When you're in a sympathetic mode, eventually, if it's long-term stress, your adrenal glands produce something called cortisol. Cortisol is a stress hormone. And when you're under stress, cortisol is released, and cortisol does a lot of things. It causes you to lay down fat, which is one of them. It's a steroid, so it can actually weaken your immune system. So let's talk about the fat issue. You're under stress, adrenal glands producing cortisol. Cortisol produces fat. Fat becomes a living, breathing organ and starts producing estrogen. Estrogen causes you to lay down fat. So now suddenly you're in this cycle. You're under stress, cortisol is released, cortisol produces fat, causes lay down fat, fat produces estrogen, estrogen causes you to lay down fat. And so now we're not in a good place because estrogen is our anti-romantic hormone. Testosterone is our pro-romantic hormone. So we need testosterone, and not just to build muscles like biceps and triceps, but what about your heart? Your heart's a muscle, your colon, your reproductive organs, your blood vessels. These are all necessary for good health. And if you're not producing a lot of testosterone or counteracting the testosterone with estrogen, you're not going to get the results that you want from health and from romance as well. So stress can be a big player. Now, there's three types of stress: chemical, physical, and emotional stress. Chemical stress would be food, drugs, alcohol, environmental toxins. That's what we talk about on the show a lot because you have control over your diet. So if you have control over your diet, you then can decide what you're going to eat or what you're not going to eat. If it's a romantic dinner and you plan on extracurricular activities, after your dinner, there's certain things you want to avoid, which is what we're talking about. So chemical stress, you have control over that. Eat more fruits, vegetables, nuts, and seeds. Take good supplements. I strongly advise you take at least Dr. Joe's Super Greens and Dr. Joe's Essential Source. That's the minimum amount of nutrients you should be taking every day. They're on the website, drjoe.com. They're 2 powders. They taste great. I take a scoop of each. I mix them together with either cold water or I like coconut milk or almond milk. I drink it. It's spectacular. It's the missing link in most people's healthcare. You have to replace those nutrients you're using up every day. That's an easy way to do it. And then there's other supplements we're going to talk about in just a few minutes. One of them is if I eat a cooked meal, any cooked meal, whether it's split pea soup or if it's Indian food or whatever, I'll take digestive enzymes, Dr. Joe's digestive enzymes, because you need enzymes to break down your food. And raw food has enzymes in it. Cooked food doesn't. So if you're eating raw food like salads and cucumbers and avocados and tomatoes, and that's going to give you enzymes and help it digest itself. Cooked food doesn't do that. You take Dr. Joe's digestive enzymes with it. And especially if you have a romantic dinner planned, you want to make sure you're digesting your food properly. So let's continue on. Foods that a food romance connection. If you're on a romantic date, what's going to happen if you're eating these foods? If you have a healthcare question, folks, lines are open. The number's 844-44-Dr. Joe, 844-44-DRJOE. The website is drjoe.com. If you want to order supplements, make appointments to see us, listen to podcasts, send me questions, drjoe.com. All right, the one thing we have to talk about is, when it comes to romance, is alcohol. Because some people, well, without alcohol, they may not have much of a social life. But alcohol does a funny thing. Alcohol lowers your testosterone levels. Now, you need testosterone. And we talked about that, right? For muscle function, for romantic function, you need your testosterone. So if you're drinking alcohol, it lowers your testosterone levels. Now, it also lowers your inhibitions. So you might think you're doing something crazy, or you might do something crazy. You might think you're sexy. You might think you're a good dancer or funny. You've all seen people like that. Hopefully it wasn't you. And it's because of the alcohol. But it's important because alcohol is a diuretic. Diuretic means what? It makes you pee. So when you pee, you lower your volume, your blood volume, because you're flushing out a lot of water. And the key to romance is this. It's all about circulation. You have to have good circulation for men and women for anything to work when it comes to romance. So circulation and nerve function are keys here. Circulation, nerve function, good chemistry, good nutrition. So if you're drinking alcohol, it's a diuretic. It makes you pee, lowers your blood volume, decreases your circulation. That can affect, like a car commercial would say, that can affect performance. So you need to have good circulation. If you're lowering testosterone and lowering your blood volume, not the place you want to be. So alcohol may not be the thing you want to add when it comes to a romantic evening. And it also decreases your stimulus, your stimuli. You don't feel things. That's why you've seen drunk people fall down and bust their head open and still lay there. You've probably done it yourself. You've done something stupid under alcohol, went home and go, where did I get this bruise from? Because alcohol reduces your ability to feel. And when it comes to romance, it's all about the neurological stimulation to make things work. So if you're numbing your nervous system, probably not a good thing for that either. Once again, alcohol, not a good choice. Now, if you have to have alcohol to look pretty or handsome, well, that's another lecture we'll have to do, maybe with some plastic surgeons or something like that. Ahmad, you never had that problem, right? Never.
No.
No.
Not that I know of.
Man, we got a good-looking team here today, folks. If it wasn't for me.
If they can only see us.
If they can only see, why can't we see you? We got Ahmad, right? Who's our screener today?
The one and only DeMarco.
DeMarco. I mean, we haven't seen DeMarco in forever. So, folks, if you have a healthcare question, DeMarco's waiting for your call, 844-44 Dr. Joe. We have Garrett, I believe perhaps the handsomest producer in all of producery. I hope Eric Von Hessler's not listening because he believes Jared is the handsomest producer in all producery. But I don't know. I think you two I think all three of you got kind of like the three best-looking guys in radio right here. And then we have Sierra, who blows all of you away.
I don't know if I trust Eric's taste.
So, folks, and then there's me. But you can't. They can see me. If you're live streaming, you can see me, which is sad. I know. I'm sorry, guys. This is what I look like. Everybody says that. Oh, that's what you look like. I said, sorry. I always have to apologize. But if you have healthcare, lines are open at 844-44 Dr. Joe. So we're talking today about the food romance connection, how food affects your love life. Oh, break time already? Oh, man, I had to introduce the crew, and now we're ready to go to break. Folks, if you have a healthcare question, give DeMarco something to do. 844-44 Dr. Joe. He's our screener. If you have any questions, you can always send them to us through our website, drjoe.com. If you want to order supplements, if you want to make an appointment in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We work on chiropractic issues, work on digestive issues, and nutrition issues. We want to get you well and keep you well. Again, the website, drjoe.com. Hey, folks, tell your friends about the show. Don't go anywhere. We'll be right back.
WSB meteorologist Kirk Millish knows.
You got some questions?
Yes.
Okay, all right.
You can
I was
go
going to
ahead.
fire you, Garrett. You were that close to being fired, you know.
All right, so what's the difference between checking your pH via saliva and urine?
Not much. It's very close. They're both pretty reliable. I like the first morning urine. That's the one I like to recommend people do. Get a pH strip, pee a little bit to clean out your urethra, wave the strip through it. Then it has a color chart. If you've ever done pH, match the color. You want to be about 6.5 to 7.0. If you 6.5 or lower, you're very acidic, not a good place to be. If you're above 7.0, you might be into alkalosis, which I've never really met anyone. And the only time I've ever heard it happens is if you're doing a lot of alkaline things like baking soda or something like that. So don't do that. So I like the urine, but they're both pretty good.
Eat baking soda?
If it's like people want to alkalize their system, so to do something really stupid and take baking soda, which is like totally insane because it alkalizes them too much, you go into alkalosis, and then you got a whole other problem. So, John in Athens, active hiker, foot trouble. Okay. Yes.
What is the best way to respond to cerebral ataxia?
What is the best way to-
cerebellar ataxia?
Okay, very good. Okay. And what was the best?
Best way to respond to.
Best way to respond to, like treat.
Yeah, what should you do?
Oh, okay. Usually what happens is we got to figure out which side of the cerebellum is being affected, and so we can stand you up and close your eyes. And if you start to fall to one side, don't do this on your own, because if you have this condition, you'll fall and hit your head. Have somebody hold their arms around you, and if you fall to one side, what we do in our office, we have to stimulate the side of the cerebellum that's going weak. And we can do that by adjusting chiropractically just that side of the body where the weakness is. And what that does is sends a neurological barrage of input up into the cerebellum, and that can help stimulate or reset that cerebellum. So that's step number one. Step number two, we have to look at the diet. Do you have enough B vitamins? B12 can affect the sheath, the neurological sheath around the nerve, the myelin sheath. So if you don't get enough B12, that can cause myelin sheaths to wear out. And if they do, they can short circuit. That can cause ataxia as well. Then we got to look at all the pinched nerves in the body, and then we got to look at the chemistry. So yeah, we've seen cases like this, and in most cases, we get pretty good results. So,
How
Sierra?
do you feel about cleanses, particularly juice-style cleanses?
Cleanses are okay. I think you should live on a cleanse every day of your life. I mean, you should live in the world of cleansing. You shouldn't put toxins in so the bodies can come out. I think it's a good idea if you're going to do juicing. I don't recommend you do fruit, too much sugar. I recommend you do mostly vegetable juices. If you want to save time and trouble with juicing, right there, Dr. Joe's Essential Source. We take fruits and vegetables, juice them, take the water out at a very low temperature, and what's left is a powder. So it's like juice in a powder form. And the reason we use a low temperature is so we don't destroy the enzymes. Then we add prebiotics, probiotics, digestive enzymes, a complete multivitamin. We have priority blends in here, specifically for circulatory blood. What?
Proprietary.
Proprietary. I give you a bell for that, okay? Proprietary blends. We have a circulatory blend. We have a digestive blend, a probiotic blend. So this is juice in a powder. And so I'd much rather you do this. It's a lot easier and cheaper too. But if you want to do juicing, I'm fine with it.
Okay, I've got a tough word to say.
Let's see if we can get it. She gets a bell if she says it right.
Okay, my father has calciphylaxis, apparently from dialysis, and also stage 4 colorectal cancer. He can't begin chemo until this is treating. Anything I can tell the doctors to do, nothing they are doing is helping.
Yeah. In cases like that, with cancer, again, I did a whole show on cancer last week. Mm-hmm. Okay. Go to my website, drjoe.com. We did a whole show on it. I'm not here to tell you to stop treatment or take treatment. That's not my job. If it were me, if it were my father and he'd listen to me, I would get him on Super Greens and Essential Source to alkalize the system, get the nutrients in there that are easy to absorb. And that's the key. With the colorectal cancer, you're not absorbing things very well. So fruits and vegetables are great if you can eat them. Super Greens and Essential Source, absolutely. You got to get them off all wheat, all dairy, all animal products, because that really is a stress on the digestive system. Vitamin D to get the immune system up. I take 5,000 international units of vitamin D every day. Mostly raw food. If he eats cooked food, I take the digestive enzymes with it as well. And from a chiropractic standpoint, we would check the nerve supply going to the organs. Because if a pinched nerve going to an organ, that organ isn't getting the messages from the brain properly, and that can be affected as well. So it's not an easy thing, but we've had people much worse, and if they say, Doc, I'll do whatever you say, and they do it, in most cases, they get very good results. Más preguntas?
And you can look on the website, drjoe.com, to watch the video about cancer and what Dr. Joe says.
Correct.
It was a really good show, too.
Yeah, you liked it, didn't you?
I did.
Can you ask him, somebody has a question about PRK. I don't know what PRK is, if they can type in the whole words. Thank you. Another question?
It says, do you visit patients? He cannot come in. He's in the hospital.
You know what PRK is?
No, I mean, I don't know. Ask her what it is.
Well, I was looking it up right here. That is it like LASIK?
I mean, whatever they give, maybe it's, is it LASIK? Sometimes they give initials, and it could mean several different things, so ask her.
This is LASIK surgery.
Yeah,
like
okay.
Yeah, it looks like the first iteration of LASIK.
Okay, way back when. Okay, just check with her, make sure that's what it is. If it's not, type it in for me. Okay, good. Okay. The question again? No, I can't make house calls. I'm sorry. I wish I could, but I can't. So, more questions?
What does nitric oxide do?
We're going to get there. You got to listen to the show. Nitric oxide is a vasodilator. It opens up your blood vessels, and very important when it comes to romance. We're going to talk about that a little somewhere along the
So
show.
what would the relationship between a vasodilator and a diuretic be?
Diuretic makes you pee. Vasodilators open up the blood vessels. So.
But they wouldn't boost each other, I guess?
No, diuretic will actually, the blood flows out and the blood vessels constrict.
Okay.
Yeah, so it's the exact opposite. Yeah. Mm-hmm. Okay. More questions? All his kids are sick. What to feed the common cold?
Hey, thank you from Misty for suggesting the winter bundle.
Yay, Misty.
She feels much better.
The winter bundle, if you don't know what that is, it's 2 of our supplements. It's Dr. Joe's Wellness Booster and Dr. Joe's Seasonal Tonic. And that's one of the questions we have coming up from Anthony in Lawrenceville. What about that? And we're going to talk about the herbs that you can take, or the supplements I take to keep myself healthy. And if I start feeling under the weather, what I take when I do feel under the weather. So I'm going to talk about that. Okay. More questions?
Yes. Are you planning any other live events?
I don't know. You got to ask Garrett that. Garrett sets my schedule. I just show up.
We have a couple of things in the works for this year. But if there are any events that you'd like him at, we can do it.
chances are you'd benefit from chiropractic care. Most people benefit from chiropractic care because care tries to get to the cause of your problems and not just cover up the symptoms. If you're ready to get well, I want you to go to my website, drjoe.com, or call 844-44-Dr.Joe and make an appointment for you, your friends, and your family today. We have offices in Marietta, Duluth, and Stockbridge. Make an appointment today so we can help get you well and keep you well. Hey folks, Dr. Joe here. So glad you're there because we're talking today about the food-romance connection, how food affects your love life and making better choices when it comes to romance. Well, that's a whole nother show. But how food can affect your love life and the things that you should do and shouldn't do. And we're going to talk about actual, real live, honest-to-goodness aphrodisiacs. We're going to tell you what actually works when it comes to romance. We've got to cover baked potatoes, coffee, desserts, bread and butter, after-dinner events, things like that. But let's start taking some callers here. If you have a question, 844-44-Dr. Joe is the number. John, how can we make your day better?
Well, this really isn't on the subject of romance.
That's quite all right.
It's all interconnected. I'm a high mileage athlete, a lot of high years too, but hike my golf, hiking the Appalachian Trail, yada yada. But out of the blue, plantar fasciitis just showed up one morning, and I've been battling it for 3 or 4 months.
Mm-hmm.
And I think I've probably answered. You've probably answered my question. I'm going to go into a radical food change, but I didn't know if there was anything specific that you've ever dealt with from a chiropractic standpoint on plantar fasciitis.
Oh, absolutely.
As well as diet.
Oh, no, we deal with plantar fasciitis every day. What happens is with plantar fasciitis is, let me back up a little bit. 1/4 of all the bones in your body are in your feet. So there's 206 bones in the body, 1/4 of them are in your feet. So any one of those bones can come out of place. And if the bone comes out of place and you're a high mileage runner, you're putting a lot of stress on that foot. And so the fascia, the connective tissue in the foot, becomes inflamed. So many times we can do steroids in there, we can do injections, we can do, roll your foot on a golf ball to try to break it up. But most cases, in fact, every case I've ever seen in 35 years of this condition, you have to go in there and adjust the foot. You got to put those bones back in place. And when you do that, it takes the stress off the fascia, the connective tissue, and then in most cases, the problem is resolved. So I would check the nerve supply in the low back because that is the nerve to the foot. Then I check the foot itself, and usually we get pretty good results with that.
Thank you. See you soon.
Thanks, John. Appreciate it. Folks, if you have a question, 844-44-Dr. Joe. Michelle, how can we make your day better?
Hi, Dr. Joe.
Hi.
Dr. Joe, I have a question about I've been wanting to have a PRK surgery
Sure.
in
Okay.
both of my eyes.
Uh-huh.
But I've been a little nervous about it. I mean, what is your opinion?
Well, I've never had it because I feel the same way you do. I'm very nervous about it. I'm nearsighted. I can't see far away. And I've thought about it several times. I've spoken to my eye doctors, and they all agreed that it's a chance. Usually it works. Usually it's successful. I've known a lot of people that say it's the greatest thing they've ever done. But I've had a few people, too, come back and say, oh, my gosh, I've had 5 other surgeries after they did the one. It didn't work. So personally, I don't think I would have it. So there's my opinion on that.
Oh, thank you so much,
Okay.
Dr. Joe. This is the only thing that is holding me back, and I hear that most people had good outcomes.
Sure.
But I'm just very nervous because I only have a pair of eyes,
Right.
and
Yeah.
just
I feel the
want to
same.
make sure that I'm doing the right
I
decision.
agree
But I
with you.
appreciate
Yeah,
your
now, one more thing.
opinion.
I have macular degeneration. I have a condition where I was actually going blind about 6-7 years ago. And I started taking Dr. Joe's Super Greens and Dr. Joe's Essential Source every day. And my eyes, and in fact, is it on the website yet, Garrett? Is it up there?
Yes.
Okay.
The iBlog.
Oh, yeah, I did a blog on this. If you go to my website, drjoe.com, you can read the article on how my vision got so much better. And we actually have the pictures of my eyes improving over the years. So if you don't want to go to something like PRK, then I'd recommend really good dietary changes, certainly including Super Greens and Essential Source. Okay?
Thank you so much.
Thanks a lot. Appreciate it. Oh, boy, lots of callers. Anthony, how can we make your day better?
Hey, doctor. I was calling. I got 3 kids. I have 2 of them with on and off fevers.
Sure.
I didn't think anything about food until I was listening for a second, and it actually kind of went off topic. But is it possible that food is causing that without having, vomiting and diarrhea and stuff like that?
Oh, yeah, because the
Or
food...
is there some kind of sickness going around
Sure.
right now?
Well,
that
there is a sickness,
has
but
symptoms?
the food has a direct bearing on your immune system. In my one book, Prescription for Extreme Health, I have a chapter on there on sugar. And if one white blood cell on average can kill 14 pathogens, bad guys. Okay, that's what one white blood cell can do. If you drink the amount of sugar in a soda, that same white blood cell can only kill one pathogen until it dies. Now, eventually, it starts to reboot itself and come back around again. But yeah, sugar, breads, cookies, cakes, donuts, pastas, dairy products cause a lot of mucus. Orange juice causes mucus. So absolutely, when it comes to people being sick, you really want to get your immune system up by changing your diet. And we have 2 supplements on my website that I take. I take one every day in the winter called Dr. Joe's Wellness Booster, and that has herbs in it, echinacea, pau d'arco, olive leaf extract, to stimulate the immune system. The other one, if you are sick, is Dr. Joe's Seasonal Tonic. Now, this is made with ginger, horseradish, cayenne pepper, onion, and garlic. So it's pretty strong. But people...
What would be good to control a fever?
With the fever, you got to keep them warm. Because what happens is if you have a virus, the body raises the body temperature to kill off the viruses. So keeping them warm, hot baths, things like that, unless it gets, of course, 103, 104, then we have to start bringing it down. But hot baths and keeping them warm is going to be a key here to help the body fight off the viruses. So, but the Super Green is the essential source I take every day. You got to get them on vitamin D as well, because everybody in the world, if it's wintertime, is going to be deficient in vitamin D unless you're taking a supplement. So you got to get them on vitamin D as well. So vitamin D, Super Greens, essential source, wellness booster, and seasonal tonic. Now with kids, the seasonal tonic's a little strong. That's what I would do, and absolutely no sugars, breads, cookies, cakes, donuts, pastas, or dairy. So,
what's your feel on the elderberry?
Oh, stuff is great. Absolutely, yes, love it.
Awesome.
All right, any other questions?
Thanks for the help, buddy.
Thanks, man. I appreciate it. And folks, if you have questions that I don't get to, you can always send them through my website, drjoe.com. The number here is 844-44-Dr.Joe. That number rings through to my offices when I'm not on the air. So, all right, let's keep talking a little bit. I'll get to your questions in a second. If you're on hold, keep holding. We're talking about a romantic dinner, what most people consider a romantic dinner, and why it really isn't a romantic dinner. So maybe you're going to have a baked potato with your romantic dinner. Now, if you go to a expensive, I should say, steak restaurant or a seafood restaurant, they have these potatoes that are they're mutant. I don't know what they look like baby pigs almost. They're so big. So I'm not sure that that's natural, and I'm not sure how they got them that big, but they sure do taste good because I've had them before. But if you're going to do a baked potato, it's complex carbs, probably a good source of energy. It can help produce serotonin. Serotonin is your happy hormone, neurotransmitter in the brain, so that's probably not so bad. Now what you're going to do is ruin it. You're going to throw things like bacon and butter and sour cream. These are fats that can activate your estrogen, increase your estrogen level in your body, so you don't want to do that because a lot of animal products have estrogen in them, especially dairy products, because estrogen is a growth hormone meant to give to the babies to help them grow. So that's something you might want to avoid because, again, we talked about estrogen and testosterone. Okay, exercise is going to be good for you because that increases your testosterone levels. But chances are, if you're on a romantic dinner, you're not going to maybe go for a walk afterwards. Now, that would be something you might want to include in your romantic evening because that exercise can help build your testosterone. If you're going to eat anything that grows underground, my rule is this. I want to make sure that it's organic. And the reason is if it's in a lot of toxic chemicals and the soil has been sprayed with chemicals and hormones and pesticides for years, it can absorb those things. If you're going to eat the skin of anything, whether it's an apple, a potato, a carrot, I recommend you do organic only as well because you want to make sure you don't get those chemicals in your body. If it's not organic, I recommend you peel it. So potato may not be a bad idea for your romantic dinner, but you don't want to slop on all the bad stuff for it. Folks, got to go to break. If you have a healthcare question, 844-44-Dr.Joe. My website, if you want to order supplements, make an appointment to come see us, drjoe.com. Hey, folks, do me a favor. Tell your friends about the show. Follow us on Facebook. Follow us on Instagram. Subscribe to my YouTube channel. We run a lot of live shows there, too. And I got to go to break. Tell your friends about the show. I'll be right back. Most people, you have neck pain, back pain, shoulder pain, numbness, tingling, headaches. Maybe it's time to stop suffering and it's time to take action. If you're sick and tired of being sick and tired, why don't you come see me and my team of doctors and let's see if you have a problem that we can help. Go to my website, drjoe.com, or call 844-44-Dr.Joe to make an appointment today because so many of you are out there suffering needlessly and we want to put a stop to that. Come see us at our offices in Marietta, Stockbridge, and Duluth. Make an appointment today so we can help get you well and keep you well. Ton of callers tonight. Holy cow.
All I could think about when you're talking about potatoes is what is it called? Artana?
Oh, the magic
potato.
Oh, yeah, magic spud, yeah. Yes.
Oh, that's so good.
Well, yeah, vegan sour cream and vegan butters and stuff. Somebody has a question about butter versus margarine, so we'll cover that, too. Neil from Florida is back on again. Yep, there we go.
I primed you on that one.
Yeah, I know. I'm ready for it. So. Okay, you have any questions, or does Sierra get the bell again?
I've got a few.
Hey, watch it.
You
All right.
gotta hurry up.
Hello, Dr. Joe. Why does my left eye tears when golfing and craniosacral therapy? I think
almost
that's,
English. Close to English, but not quite. Well, golfing puts a lot of torsion into your spinal cord, so that could be putting pressure on the brain and the spinal cord and nerves. Craniosacral therapy would be realigning the spine and the skull and getting everything lined up properly to work properly. So whenever something happens with an organ, I always check the nerve supply to the organ. So I would check the skull and the spine, the upper spine, for that first and see if that helps. Golf, I've been in practice a long time. The #1 sports injury we see by far, bar none, golf. Because you plant your feet and you twist your disc. Absolutely, the one position a disc isn't designed to turn in is rotation. It's designed for axial force. It's not designed for rotation. So golf really tears you up. I mean, even the greats, I mean, the professionals, young professionals like Tiger Woods have had knee surgery and back surgery because it tears it up. So it's a tough one. Yeah, that's why I don't play golf. So.
Oh, Rolf therapy, Rolfing.
Yeah, Rolfing might help. Hurts like heck, though, if you ever had it done. Ooh, God, it hurts. Ow, 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 ow. Look at all these callers tonight. Where's everybody been?
So his left eye tears up when he's doing Rolf therapy.
Oh, Rolfing, not golfing. Okay,
yeah.
Well, never mind.
I thought it was a typo.
Okay, I'm going to take away Garrett's bell. I don't know how to take a bell away, but Rolfing, yes. Okay, well, it's stimulating the nerves. When you're doing Rolfing, it's breaking up a lot of the scar tissue and the connective tissue in there. So it's stimulating the nerves, so it's stimulating the nerves that control the lacrimal gland, so that's probably what's going on. Yeah. But if you're okay with the Rolfing, keep doing it.
Are B12 levels shown in a blood test?
If you order it, you got to make sure it's ordered. There's standard blood tests, there's different types of blood tests, so make sure you get your B12 levels tested.
I thought you said if you water it.
If you water it, you got to water your blood.
I was like...
If you order it. What's the matter for you? You don't know how to talk good or what, eh?
And lastly... You've had plenty. What is the best treatment for the superbug Pseudomonas?
Okay, wellness booster every day. Vitamin D3, absolutely positively. Seasonal tonic, I would take that if I am sick. And you got to give up the things that weaken the immune system. Alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. And then if it's a serious issue, I do like things like oil of oregano would go pretty well, and lots of garlic. Because garlic is antibiotic, antiviral, and antifungal. Take the raw garlic, run it through a garlic press, let it sit for about 5 minutes, and then eat it on a salad or something like that. Don't cook it. Eat it raw, and that's what I would do if I had a superbug. So, along with the medical recommendations, cover my fanny.
I have a friend who drinks plenty of water and fluids, yet he is always thirsty. Now he has anxiety. He's a vegetarian living in India, and his doctors are stopped. Any possible causes?
Yes, Indian food is all cooked. And a lot of times that can put a lot of stress on the pancreas, which then can affect insulin function, which can have diabetic-like reactions. And diabetes, one of the symptoms is chronic thirst. So I love Indian food. I wish it wasn't all cooked. So I'd recommend getting some raw food in his diet, some digestive enzymes in his diet, and let's see if that helps. And get checked for diabetes too. Because again, you could be a vegetarian not eating well. You could be eating breads, cookies, cakes, donuts, pastas, potatoes, butter,
beer.
Oh, red alert. That's not us. Yeah, beer. So you got to really look at his diet. Just because he's vegetarian doesn't mean he's healthy. And I wish that was not the case. But I've known unhealthy vegetarians, and I've known better, healthier meat eaters because they eat a lot of fruits and vegetables along with it. So sorry about that. But try the Super Greens, the Essential Source. You can ship that to him. You can try that. That's going to give him a lot of enzymes and raw food there.
And then quick one, will nitric oxide help with headaches?
It can, yes. Try it and see. I would take 1 pill one day, 2 the next day, 3 the next day, and 4 the next day, and then see if that helps. I don't want to have a rebound effect and open up the blood vessels and cause problems. So I would say yes.
So you.
Okay, can you?
Sorry.
You can have the next break.
Dr. Joe Esposito on News 95.5 and AM 750 WSB.
Hey folks, Dr. Joe here. So glad you're there. We're talking today about the food romance connection. And boy, we're getting a lot of callers and a lot of folks on social media sending in questions. So it is obviously a hot topic. If you have any questions, the number is 844-44-Dr. And I guess I'll take some callers because I got a ton of callers here. Let's go. Neil, how can we make your day better? Quickly, please.
Could you clarify something from last week, Doctor?
Sure.
Okay. Are you convinced that dental implants have the same potential for low-grade chronic infection as root canals?
Yes. If the tooth is dead in your mouth, the body will start attacking it. So if the tooth is dead and you put a cap on it, that's one thing. If you put the implant in with the metal rod, the body's also, there's going to be little canals on the side that can have anaerobic bacteria in it that can also cause the infection. So neither one is ideal. Absolutely.
That's why you're thinking of having a implant reversal.
That's why I'm thinking about it. Absolutely, yes, that is correct. Mm-hmm.
And you also believe that the only safe alternative to a missing tooth would be partial dentures or bridges.
That's my opinion. Yes, absolutely.
And final question, I'll let you go. The remaining root tip beneath the gum line, if it's not a source of acute infection, can that be left, or do you recommend it be extracted?
Yeah, I don't like any dead tissue in the body. Dead tissue in the body's always going to have an immune system reaction. So if we can get any dead tissue out, I think that's a good idea.
So you recommend extraction in almost all cases?
Yep. There you go.
Thank you, Doctor.
Thanks, Neil. Appreciate the call. Let's see. Where are we time-wise? Yeah, we got some time here. Let's go to some more questions here.
Hey.
Bill. Oh, Bill, you there?
Yes.
Hey, Bill.
Hi, Dr. Joe.
Hi there.
Hi there. I wanted to talk to you about the gluten. So how does gluten affect the brain?
Weak gluten breaks down to two components, gliadin and glutenin. And when they get into the body, it causes an inflammatory reaction. And that inflammatory reaction in the colon can become systemic. It can go through the whole body. And so if the brain has an inflammatory situation going on, that can cause the brain to malfunction and cause that brain fog. So by cleaning up the gut, many times the brain just reboots itself and starts working again. So I try to do very little gluten, and I think everybody should kind of go along with that theory. So.
Yes. So, and last time, there are some of the noodles that last time I went to the Kennesaw restaurant buffet called Specificatia, my dad's favorite, and then we took with Beto, and we ate pastas. There's some pastas and others. And does buffet have any gluten in them?
Most pastas have, if you do a rice pasta, you're okay with that. But if it's a wheat pasta, the answer is yes, it has gluten in it. So if you're going to go to do pastas, I'd recommend a gluten-free or a rice pasta, yes.
Yeah, so
okay.
There are other foods, other presents, like bread, like restaurants and others. Does restaurants have any gluten?
Yeah, anything that has wheat in it is going to have gluten in it, Bill. Got to run. I got another caller. Thanks so much. Yeah, anything that has wheat in it is going to give you gluten, folks, and that's wheat, barley, and rye, actually. Michael, how can we make your day better?
Hey, sir, I was looking at, so I'm a CrossFitter, me and the wife, and we eat paleo and keto. However, I'm not recovering fast enough. Like, I pulled my IT band, and that's causing me a lot of problems. And I can't, it's something that I got to nail down in the diet, and I'm not sure what. Do you have any idea?
Sure. Well, the body uses glucose as its primary fuel for energy. And so if we're going keto, and again, keto, I've talked about this many times in the past. If you're going to do keto, I recommend short term, probably 2 or 3 months on and then about a month or two off. 2 or 3 months on, month or two off. Because when the body, yes, it can use ketones as a secondary fuel, but it's not the ideal fuel. And now I'll argue with the keto folks on that one. But we find that cycling in and out of the ketogenic diet is a much better choice. And now if you have an injury, you want to maybe consider chiropractic care because you may have a pinched nerve going to that organ. So
I already have a sports med guy from my university and the chiropractor. So.
Beautiful. Good.
Yeah.
Okay. Excellent. That's probably what's going on.
Right,
so
yeah.
I recommend cycling in and out. All right? Thanks, man.
Okay, thank you.
Appreciate the call. And folks, if you have a question, 844-44 Dr. Joe. Alan, how can we make your day better?
Hey, Dr. Joe. How are you? Thanks for taking my call. Really quick question. My wife was recently diagnosed with fibromyalgia. She deals with constant pain.
Yes.
And she's really in good shape. She eats well. But just trying to see if there's anything that is recommended in regards.
Oh, absolutely. Yeah. Garrett, would you ever do a show on fibro? I think I have one on the website on fibro.
We may have one before me.
No, there was a time before you were here? I didn't know there was a time, you know? Yes, if you go to my website, drjoe.com, and go type in fibromyalgia, we may have we have an article or a show on that. But what we need to do with fibro is several things. Number one, we've got to alkalize the system. I'd recommend giving up the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. I'm going to talk a little bit about a supplement called Nitric Oxide that's very good for romance. It opens up the blood vessels, but I find fibro patients do very well with it as well because it's a vasodilator. It opens up the blood vessels. So that would be something. And chiropractic care and fibro are just a natural. We get such great results with fibro patients with chiropractic care, so I would consider that as well.
Yes, sir. Okay.
Okay?
Awesome. Thank you so much.
Thanks so much, Alan. Appreciate it. And folks, all the supplements we talk about are on my website, drjoe.com. And we can always do a custom plan for you as well. If you go to the website, you can book an appointment to come see us. And we'd like to check the nervous system, the digestive system, and your diet. We do that with all our patients. And then we give you advice as to what direction we think you should go in. And whatever you decide to do is totally up to you. All right, James, how can we make your day better?
Yes, I had open heart surgery. And ever since I've had it, seems like all my inner is pulled up, my stomach and all.
Sure.
I keep acid reflux real bad.
Oh, yeah.
And my shoulders are popping, my collarbones popping.
Sure.
Is there anything you can do with that?
Absolutely, yeah. And again, sometimes we need the surgery. I'm not against that. But what happens is when they cut you open, the bones can move out of place. The stomach can push up against the diaphragm. So you sound like a perfect chiropractic patient there, James. We can get the bones lined up. We can take the stomach and pull it down away from the diaphragm to help that acid reflux and then get you on a diet so that we can fix the problem. Because if you had open heart surgery once and you keep doing what you kept doing, chances are you're going to have open heart surgery again. So let's fix the diet as well. Let's stop that from happening.
Okay. We'll be making an appointment to see you then.
Thanks, Jay. Yeah, just go drjoe.com or the number you just dialed. You can call it when we're on the air. When we're not on the air, you can make an appointment, okay?
Okay, thanks,
James.
sir.
I appreciate it. If you do want to make an appointment, folks, 844-44-Dr. or drjoe.com. You do it right online. How technologically advanced are we? And we have offices in the Atlanta area, Marietta, Duluth, and Stockbridge. All right. Got the callers out of the way. If you have any questions, 844-44-Dr. We can start another list of callers there. So we're talking about the food romance connection and what happens when you put certain foods in your body and why it's not a good idea. We talked about the animal products clumping the red blood cells together, and that can be a problem because it doesn't, you can't carry oxygen, and God knows you need oxygen when it comes to romance. So let's talk about coffee. Maybe not. Ahmad put on some romantic music. That means I got to go to a break. Folks, if you have a healthcare question, 844-44-Dr. My website is drjoe.com. You can make an appointment there if you'd like to see us. We have all the supplements are online. We have over 1,000 hours of podcasts there. And do me a favor, follow us on Facebook, follow us on Instagram, and on YouTube. You subscribe to my YouTube channel because we live stream a lot of our shows and you get to see my pretty face as well. Folks, I'm Dr. Joe Esposito. Do me a favor, tell your friends about the show. We're going to be right back.
If you are struggling to find job...
So loud. All right, long break here. Oh, we make a long break.
I'm going to ask one question and then I'll let Garrett go.
Okay.
Okay, so going back to the woman whose father has a cancer.
Yes.
He is on a puree diet because of something with his swallowing/speech.
Mm-hmm.
Can the hospital puree his fruits and veggies? Just told them no dairy/no meat.
You could ask him. Okay, we've had people that are on a feeding tube. Super Green's an essential source at least once a day, usually twice a day. Avocado, smash it up. It'll puree real nicely. Put it in there. You need those essential fatty acids as well. So throw an avocado or two in there every day. Hopefully the hospital will work with you. I don't know if they will or not. It depends on the hospital, but usually they do. And a lot of hospitals know who I am, so they're like, oh, Dr. Joe said it. I guess we can do it. So I don't want to go against what they're doing, but I'm saying let's add this to it. And I think you'll be happy. And the vitamin D. Put the vitamin D right in the feeding tube. You've got to get that vitamin D in the system to get the immune system up. So important.
Could you please recommend some pseudo grains? I already use millet and sorghum, but wanted to see if I could explore more options.
Ooh. Quinoa might be an option. You could try that one. That's probably all you really need. You don't want to do wheat. Oats, that's not really a grain. Yeah, I guess I wouldn't do oats either. I do a little bit of oats here and there, not every day. But the key is they're still sugars. So if I can, I'd like to get you away from even the pseudo grains and the seeds and get more into fruits, vegetables, nuts, and regular seeds. You know, seeds you would consider like other seeds like sunflower seeds. You're going to do a lot better with that. So I know the pseudo grains are great. Of course, you can do cauliflower as a pseudo grain to replace rice. And again, rice is a grass seed. It's not really a grain, it's a seed. But again, it's just semantics. But the more you can pull away from those things like that, the better off you're going to be.
Now, in the same line, if our body can tolerate gluten,
yes,
is it recommended we go gluten-free for a short amount of time?
Well, I think you should go gluten-free because A, it's still a sugar. B, if it's not organic, chances are they sprayed it with glyphosate, which is weed killer, and you can get the glyphosate in the body. And a lot of research now is coming out that a lot of people may not have gluten intolerance. They may have glyphosate intolerance, which everyone has. And the gluten could be causing subclinical issues. What that means is you're not aware of it, but it's happening. So right now I'm digesting my food. Well, it's a subclinical reaction. I don't know I'm digesting what I had for dinner tonight. Had a salad. I went to a salad bar and had salad. So I don't know I'm digesting it. It's subclinical, but it's happening. So I don't think anyone does well with wheat. And if you take it out of the system, and here's my challenge to you: cut it out for 2 or 3 weeks, put it back in, see how you feel. And there you go. But again, you're cutting out the wheat anyway. I'm sorry, but that's for everybody else. But yeah, the more you can pull away from the grains, the better off you're going to be.
Is anybody really tolerant to gluten?
No, not really, because you don't have the enzymes to break it down. Like no one's tolerant to dairy because we don't have lactase. Yeah, to break down the lactose, we don't have that enzyme. So people say I don't have a reaction to it. You have to have some reaction because you don't have the lactase to break down the lactose. We don't produce it. I got to do liners.
Okay.
Hold your questions, folks. Got to do liners for my other stations around the country. So. Oh, there we go. I'm Dr. Joe Esposito, and this week we're talking about the food-romance connection. Find out how what you're eating can be affecting your love life. Dr. Joe Esposito here. This week on my show, we'll be discussing the food-romance connection. And we're going to give you tips on certain foods you can eat that can actually improve your love life. Hey, we're talking about the food-romance connection, and we're even going to give you some foods that are real-life aphrodisiacs this week on the Dr. Joe Show. Okay, Banky.
Got more questions?
I do. Does a weighted vest work best for gait disorder?
For gait disorder? Might, but I'd rather do chiropractic and neurological work to fix the problem. It might help, but I understand the principle behind it, but it doesn't fix the cause. So that's why I'd rather chiropractic and nutrition, I think, works a lot better. So.
What's better for you, a green banana or fully ripe spotted banana?
Fully ripe spotted banana.
What's that chemical?
Yeah, I can't remember the name of it. Yeah.
Isn't it something that as it turns more brown?
Yeah.
Releases more.
Yeah, I know that. I can't think of it right now what it is. Yeah, so that's funny.
If anybody knows.
Anybody knows? You'll get a bell if you get it right. There you go. That's your prize. Sierra's kicking your butt. Garrett, I don't want to say it. I mean, you know, you're my friend.
I got 3 channels over here.
And she's got one, and she's just slick. I mean,
Instagram, they're just having
and Instagram folks share all this information because we're getting toward 10,000 followers, and we want to become an influencer. Can I say that? So share. So let's get us up to 10,000 followers real fast. Okay, I need your help. You're now an ambassador.
We are gonna have one heck of a giveaway come 10,000.
Oh, we are?
Oh yeah.
Garrett loves spending my money. Let me tell you, man. I can't stop him. He just does it, and then he tells me afterwards, you know? It's like, oh, by the way, you know what I did? So.
Okay, quick thing. She asked, super grains and essential source can go into the feeding tube,
Absolutely,
correct?
Yes. Mm-hmm.
Okay, and then is there a way to prevent migraines that I get when trying to stop drink coffee?
Yes. If you go to my first book, Eating Right for the Health of It, we have a whole chapter in there, as a matter of fact, on that. It's called Kicking the Habit. So instead of buying, we should buy the book, by the way, but I'm going to give you this one. I'm going to give you a freebie. Take a cup of organic coffee in front of you. No cream, no sugar. Take 1 tablespoon every hour. That's going to give you just enough caffeine to deal with the adenosine receptor sites. That's a whole nother show on how caffeine affects the brain, the adenosine receptor sites. And 1 tablespoon an hour. And what you'll find is the longest it's ever taken anyone to get off the coffee has been 5 days. So, I say bye to Renee. It's funny, I walk into the break room. She goes, uh-oh. I said, what? She goes, I'm standing here in front of the microwave with my food in plastic in the microwave. I said, Renee. She goes, I am sorry. So, people walks on eggshells when I'm around here in the studio. So.
Okay, you said sugar reduces the potency of white blood cells. What has the opposite effect? Not maintaining, but enhancing their ability to stop pathogens.
Echinacea, Padiarco, olive leaf extract, suma root. You can help it with garlic and olive leaf extract. So with garlic and olive leaf extract. Yeah, I was right there. Okay. My mouth thinks faster than my brain thinks. So.
And by the way, he said that really quickly. So just know you can go back and listen to that again. It'll be at the very end of this 1 hour segment of the stream.
Vitamin D, wellness booster. We don't have any seasonal tonic here. But these are the 2 that really help the immune system tremendously. So you got to get that vitamin D, folks.
There you go.
I'm going to make it an essential nutrient when I become Grand Poobah of the universe.
Which is not far off so far.
So far, we're real close to the Grand Poobah of the universe. You know, it's funny now, because it's weird. Like, I was at a meeting yesterday, as a matter of fact. I was at a conference. And some of my colleagues came up to me and they said, should we ask for your autograph? And I said, well, I've known you guys for 30 years. What are you talking about? They go, well, you're like a big star now. Everywhere we go, you know Dr. Joe, you know Dr. Joe. My patients come in and say, you know this guy on the radio? He's a good friend of mine. So it's kind of cool. I said, nope, no autographs. Questions? More questions?
Misty said, that's my struggle, coffee, and I still have the migraines.
Misty, this is for you. Stop it.
All right.
She said that she will get the book as well.
Okay, there you go. All right, good. I got to pay Garrett's salary here somehow. Come on, guys. You got to help me out.
Come on. I'm fighting for a
10
raise.
seconds left on Instagram. We will be right back.
We'll be right back.
Melanie Kais in the WSB 24-hour traffic center. We were watching a red alert in Cobb County I-285.
I feel like I made a big step up in my life yesterday.
What's that?
I bought my first pair of tennis shoes in like 12 years.
Oh, you grown up.
Yeah.
You're adulting. That was so funny. We had like 10 people on hold, and all of a sudden, nothing now.
I can do that thing that people talk about. What is it called? Running?
Running? He's running. My broken back, I can't run. I run a few feet, and I'm like, oh, that hurts.
I'm going to do that if someone's chasing me.
Yeah, right, yeah. Cops are behind me, then I can run.
Likely at times overnight, lows around 47.
Hopping fences back in Jersey and stuff. Ah, the old days.
Partly cloudy afternoon.
We could do a whole show on just what was Dr. Joe like before?
I think all my pictures.
Before I went
my
vegan.
football pictures.
80% likely at times.
With big musclehead football pictures.
46 degrees on
There we go.
Main Street at News 95.5 and AM 750 WSB. Depend on it.
The information presented on this program is not intended to take the place of physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Hey folks, Dr. Joe here. So glad you're with us today. As always, you guys make this show. I do appreciate it. And I appreciate all your questions that if you have questions, call them in 844-44 Dr. Joe. I appreciate those questions. And you don't know this, but Garrett and I and Sierra, we look at these questions and we'll say, okay, what's hot topics? Let's do shows on that. So your questions really help drive the shows that we're going to do in the future, too, so we do appreciate that. And if you don't know it yet, we have well over 1,000 hours of podcasts on our website, drjoe.com. If you have a podcast service, it's called For the Health of It, which is the title of my first book, Eating Right for the Health of It. My second book is Prescription for Extreme Health. So you could always get the books and listen to podcasts, and it's always cool when I run into somebody and they go, hey, you're the guy in a podcast. I'm like, oh, I guess you listen to my podcast then. And we have audio and video. And follow us on Facebook, follow us on Instagram, YouTube, subscribe to our YouTube channel because we stream a lot of our live events, we shows, and we did a live lecture this week. We streamed it. So if you like what you're hearing, you can actually see it then at drjoe.com. So we're talking today about the food romance connection, how food affects or adversely affects your love life. If you have a healthcare question, again, 844-44 Dr. Joe. So we talked a little bit about coffee, and then Ahmad rudely interrupted me. Why did you do that?
With music?
Yeah, I got good.
We have times to hit in radio.
That Ahmad, man, he's brutal to me. Brutal he is. Yeah, he makes me stop when we have to go to commercials. Oh, how dare he? But anyway, right before we went to break, we were talking about coffee and what happens with coffee. Now, coffee increases something in your blood called homocysteine. Homocysteine causes the cholesterol to stick to the artery walls. It's part of that whole process, and I did a show on that a couple of weeks ago, which, of course, is on the website, drjoe.com. So this is where I said when it comes to romance, circulation and nerve supply is everything. So if you start having clogged arteries because you're drinking coffee, getting homocysteine, as you clog up the arteries, you're getting less blood flow. Now, when it comes to romance, for men and women, you have to have blood flow. You have to have good circulation. And one of the issues we have is as people get older, the blood vessels can get a little clogged up, and especially these little tiny small blood vessels that supply the romantic parts of the body can get clogged up, and they're not going to work as well. Stress can do that. Coffee can do that. Bad diet can do that. So really, I know you like your coffee, folks, but it may be a good idea to consider cutting back, and I call it one of the 7 deadly sins. It's also an acid. It robs your body of calcium. And when we talked about this earlier with meats, calcium is necessary to relax the body. When it comes to romance, your body has to go into what's called a parasympathetic mode. Sympathetic mode speeds you up. Parasympathetic mode slows you down. And you need calcium to relax the body and get it to shift into parasympathetic mode. So if you're drinking a lot of acid foods and eating a lot of acid foods, you're robbing the body of that important calcium. It's also diuretic. Diuretic means what? It makes you pee. And you need blood supply, and if you're peeing out all your fluids, the blood is going to get thicker, and it's not going to flow as easily, so that's not a good thing either. It makes you sweat, of course. It makes you stink, and of course, that's not fun for romance. You may have to run to the bathroom, because some people say, like in the morning, they have to have their coffee in order to get their day going, have their morning constitution. And so may not be something you want to do if you want to avoid running off to the bathroom. Now, if you put sugar in it, we talked about how sugar weakens the immune system. And if you're putting sugar in your coffee, that's not a good thing. If you're using artificial sweetener in your coffee, like aspartame, for example, aspartame breaks down to 3 components: aspartic acid, phenylalanine, and methyl esters. And when aspartic acid, phenylalanine, and methyl esters get into the body, the aspartic acid is an excitotoxin. It causes the brain to fire faster than it's supposed to and can actually overexcite and burn out your brain cells. And the number one side effect of aspartame is headaches. And of course, what's the standard reason why we don't want to have a romantic encounter? Could be the classic is, I have a headache. So if you're having your romantic dinner and you're going to have coffee with artificial sweetener in it, may not be a good idea. And I can't tell you how many patients have come to our chiropractic clinics over the years with headaches, and we give them the best chiropractic care in the world. We think so anyway. And they may not be getting the results they want. And then we do a nutritional workup on them. And something as simple as cutting out the artificial sweetener is amazing. So if you're at your romantic dinner, sugar's not good for your immune system. Artificial sweetener certainly isn't good for a lot of things, including romance. You might want to consider something like stevia. Now, here's the thing. You can carry little packets of stevia with you and just pull it out of your pocket if you want to use it. It's fine. I have little packets of stevia in my car. And so if I ever am somewhere and I just, for some reason, have to have something sweet, I can go get my little packets of stevia and use it. Now, what's cool is a lot of restaurants now and even coffee shops are starting to use stevia. So we can put this in the Dr. Joe is right column. I talked about stevia decades ago and how it's going to become the new #1 sweetener in the world, and no one even heard of it at the time. And now you're starting to see even the soda companies, the major soda companies, sweetening a lot of their sodas with stevia. So we'll put this in the Dr. Joe is right column because I was right. Again, we like that. If you put sugar in your body, it spikes your insulin levels, along with your other things that you had for dinner. Spikes your insulin levels, then you crash. That's not a good thing because you get that rush of energy and then you crash, and that's not a lot of fun when it comes to romance. And aspartame is a vasodilator. We talked about how aspartame causes headaches, and the reason is the vasodilator. It cuts off the blood supply to your brain and also to your romantic parts, and you need circulation. Remember, when it comes to romance, circulation and neurology, good nerve supply is everything. So you want to make sure that everything's working the way it's supposed to. So not a good idea. Now, I was at a luncheon yesterday, and everybody at the luncheon had salmon and grits. It was a seminar, and the luncheon was included. And I said to the waitress, I'm a vegan. And she said, okay. And she came back with this amazing salad, which had hearts of palm and everything in it. And then there was some grilled veggies and some mushrooms and some, I think some spinach might have been in there, some broccoli. Yeah, broccoli tips were in there. A small sweet potato was in there. And everybody looked at my meal and said, your meal looks so good. And I said, I wanted to say, but your salmon looks horrible. But I didn't. And then at the end, everybody had chocolate desserts, and I had berries. Now, I'm going to talk about chocolate in a second because I know I'm going to say something nice about chocolate. How about that? So that's going to be my tease for the next segment. And I had a bowl of berries. Now, berries are loaded with proanthocyanidins and antioxidants and nutrients that my body needs. And after lunch, I was looking around, and about half the people had their head down on the table falling asleep, and I was paying attention. So my meal was actually cheaper than everybody else's. I didn't pay. My meal was cheaper than everybody else's, better than everybody else's, and I was able to pay attention for the second half of the seminar. Folks, I'm Dr. Joe Esposito. If you have a healthcare question, lines are open, 844-44-Dr.Joe. That number rings through to my offices when I'm not on the air if you want to make an appointment to come see us. All the supplements we talk about, all the information is on the website, drjoe.com, and this show will be on the website tomorrow at drjoe.com. Hey, folks, do me a favor. Tell your friends about the show. Call in with any questions. 844-44-Dr.Joe. We'll be right back. Like you, neck pain, back pain, shoulder pain, headaches, chances are you'd benefit from chiropractic care. Most people benefit from chiropractic care because chiropractic care tries to get to the cause of your problems and not just cover up the symptoms. If you're ready to get well, I want you to go to my website, drjoe.com, or call 844-44-Dr.Joe
and make an appointment for you, your friends, and your family today. We have offices in Marietta, Duluth, and Stockbridge. Make an appointment today so we can help get you well and keep you well.
Hi, Candace Presley, co-host of
Candace, my friend. All right, who's got questions?
I do. I've got
All
a
right.
quick one, and then it's Garrett's turn.
All right, go ahead. We only have 45 minutes left. So
Will adding super greens an essential source to warm water distort any of the nutrients?
if it's above 110 degrees, you probably want to keep it below 110 degrees. How about that?
So just stick with cold water.
Stick with cold water. I like coconut milk or almond milk personally. I like it better than water, but yeah, you can use warm water, but not hot water. There you go. Steve Winslow, WSB, traffic. Just walked in.
Is there anything you recommend for someone that's having trouble holding their urine?
Yes, chiropractic care. The nerves in the low back control the bladder, and then we can actually adjust the bladder itself too. And I've had tons of patients with this problem, and boy, you fix that problem, and they love you. Yeah, and I had some patients that I fixed years ago, and they came back in. I'm trying to get them to see my other doctors. Like, no, I don't want to see you. All my doctors are as good or better than I am. I mean this. So when you come to see us, usually I'll meet you for the first visit, but then my other doctors will take over. Trust me, you're getting as good or better care from them than you're going to get from me. So, but yeah, you can adjust the low back and the bladder. So,
Any ideas for a coffee substitute?
Postum is one option.
What's that mushroom coffee everybody was recommending?
Yeah, it's a mushroom. Well, it has mushrooms in it, I think, but it's still coffee, isn't it? I don't think it's just a mushroom coffee. Yeah.
I thought it was just mushrooms.
Yeah. Okay. Roast aroma is something that you might want to try as well. Postum is another one, but there are coffee substitutes out there. There's plenty of them. Yeah. They don't taste exactly like coffee, but they'll work.
Now, Dr. Joe, my wife has difficulties when it comes to falling asleep.
Okay.
Sometimes it can take her hours.
Yes.
Could you recommend me, please, some supplements, herbs, or oils that could help her?
Go to my website, drjoe.com, put on one of these podcasts, out she'll go. No.
He's thinking about CBD oil.
Okay, CBD oil is okay, but here's the thing. With sleep, usually people that have sleep issues have a digestive issue. And so if she has acid reflux, heartburn, burping, gas, bloating, we need to pull the stomach away from the diaphragm. The stomach's job is to take proteins and break them into amino acids. The amino acid tryptophan becomes serotonin in your brain. Serotonin becomes melatonin. If you take melatonin, you can have problems with it because your body stops producing its own, and then you become hooked on it. So I'd rather fix her stomach, and I'd also get her on Super Greens Essential Source and Digestive Enzymes, Dr. Joe's Digestive Enzymes, to break the proteins into amino acids to produce the neurotransmitters, to produce the melatonin, so that hopefully she'll start to sleep again. That's my approach. And it usually works pretty darn well. So have her come see us, and we'll fix her stomach, hopefully, if she has it. Seeds are good for us, but seed oil is not. Okay.
Are the super greens an essential source good for all ages, or do you need to like change for different?
Any age. Nope, works
Unless
great.
they're really young, then you start with a small amount.
Yeah, if they can eat solid foods, they can eat super greens and essential source. And again, if it's a little tiny baby, you might want to give them a quarter teaspoon and then build it up from there. What else?
You got any more questions?
What'd you eat today?
What did I eat today? You always ask me that question, you know? Why you always ask me that question? What's the matter for you?
I like that question.
You like that question? Okay. I had a big salad for breakfast. I actually had a salad for breakfast, then I had a wrap. And I had this gluten-free vegan wrap, and I had it in the refrigerator, so I had to use it. And I put hearts of palm in it, lettuce, mustard, artichoke hearts, nutritional yeast, rolled it up and ate that. Then for lunch, dinner, I went to a salad bar, had a big salad. I had 2 bowls of salad, and I had 1 bowl of minestrone soup that was vegan. I did have a little split pea soup again today because it's winter, and I have split pea soup everywhere.
I've got to get that recipe from you.
I guess I got it right. I don't know if it's in my book or not. I don't know. It's real simple. So split peas, vegetable bouillon, carrots, onions, and celery. Put it in a crock pot, cook it for 6 hours, and you're done. So
I ask you that question. It's kind of like watching The Office just over and over and over again for the last like 8 years. I know the answer is going to be good. I know what you're going to say for the most part, but it's still nice to hear.
It's still nice to hear, yeah. And lots of tea, and lots of water, and super greens and essential source, and all my other supplements. Quick question?
Are there conductors of the brain's electricity other than nerves that can help improve the nervous function?
Well, neurotransmitters make the nerves work, and then sodium and potassium are... Oh, here we go.
By looking at your... Learn what you what not to eat to get healthy. Dr. Joe Esposito is on News 95.5 and AM 750 WSB.
Hey folks, Dr. Joe here. So glad you're there because we're talking about the food romance connection and how food affects your love life, or doesn't affect your love life actually, and how adversely affect your love life. I did give you tease before. If you're just tuning in, I gave a tease right before the break, and I said I'm going to say something nice about chocolate. How about that? So if you're going to do chocolate has a chemical in it called phenylethylamines. Now, phenylethylamines are neurotransmitters that are released in your brain when you're in love. So it's kind of cool. So what happens is, when you're in love, these chemicals are released, and you get that stupid feeling in your brain. And when you eat chocolate, you kind of get that similar stupid feeling. So this, my theory, is why men give women chocolate, because we know we screwed up. We don't know how or why, but we know we did. So if we can give you chocolate, you'll like us, at least for a few hours. And so that's our little trick, girls. I shouldn't tell you that. That's our little trick. We're giving you this little drug to make you like us a little bit. But if you're going to eat chocolate, here's the rules. It's got to be organic. It's got to be dark chocolate, no dairy. And it's got to be about the size of your top of your thumb joint, that one joint in your thumb. And that's it. And that's enough to get you high. If you eat too much, the sugar is going to be bad for you. So I'm going to give you a little, I'm going to negotiate with you on chocolate here. So if you're going to do it, that's how you got to do it. So as we're talking more about the food romance connection, a bite of chocolate probably wouldn't be so bad. How about that? But if you're going to eat something like cheesecake, again, we talked about the dairy products and the saturated fats, and it clumps your red blood cells together, not a good idea. The dairy can cause hardening of the arteries. It's high in estrogen, counteracts testosterone, not good for your love life. And also, here's the thing with dessert. It's usually too much food. Now, if we look at the Christian Bible, we look at the story of Adam and Eve. And Adam and Eve, the story is, if you probably know the story, that Eve was told you can have anything you want in the garden, but don't eat the apple. And she ate the apple, and then God said, "Oh, you're in trouble," and all the problems started. If we look at Sanskrit, which is Indian from India scripture, the story is similar. But the way the story is told there is that they were told, Adam and Eve were told, you can have anything you want, as much as you want, but don't take more than you need. And so when Eve ate the apple, their original sin is gluttony, taking more than you need. And boy, who's not guilty of gluttony? So when it comes to romance, we said the number one consumer of energy is romance, and number two consumer of energy is digestion. If you're eating a heavy meal and certainly too much food, it's going to have an impact on how much energy you have. And you know this. You eat a big meal and you're wiped out. I mean, here's your challenge. Tomorrow for lunch, big salad. And you can put some nutritional yeast in it, some apple cider vinegar, and just the whole garden in there, and avocados and cucumbers and lettuce and tomatoes, and have that salad, see how you feel. The next day, have a couple slices of pizza, maybe a calzone, maybe a soda, some dessert, maybe a couple of cookies, see how you feel. You're going to be wiped out. So why, I ask you, would you want to wipe yourself out for anything? Not just romance, but for work, for friends, for doing a radio show, for listening to a radio show. Why would you want to do that? And the only reason I can give you is that those bad foods can stimulate the dopamine receptor sites in your brain and you get high. That's it. And so I'd strongly advise that you consider gluttony as one of the things, as part of your nutritional protocol, and you want to be careful not to indulge in gluttony because it's not good for you. It will cause all sorts of problems, especially if you're going to have a romantic dinner planned, a light dinner, maybe a salad. And here's, we're going to talk about that in next segment here. What to eat, actual foods that you can start adding to your diet, not just for romance, but to actually increase your energy levels. You know, people ask me all the time, Dr. Joe, where do you get this energy from? And I said, I run circles around the 20-year-olds. And they look at me and go, what are you doing, man? And how do you do it? And it's like, well, it's not hard. It's easy. I just don't poison myself.
True story, by the way. He has 10 times more energy than me.
That's right. I'm a little bit older than you, right? Yeah, and it is true. I mean, you know, I look at Garrett, and it's like 5, 6 o'clock at night, and I'm like, what are you doing? I'm going home. What are you going home for, man? It's like the day's just starting here. Come on. And it does make a difference. But what happened when you changed your diet, Garrett?
For starters, my ADHD. That was probably the number one thing that changed for me.
Yeah, and you had more energy and you feel better.
More energy, I could use it.
Yes. Got to keep up with the old man here, so. Yep. So, folks, if you have a healthcare question, 844-44-Dr. Joe, and that's Garrett telling you that this stuff really works. Tony, how can we make your day better?
Hey there, thanks for the time. I got a question about seeds versus seed oil. So my question is, why are seeds good for you, like sunflower seeds, and why is seed oil bad for you? So I hear like sunflower oil, canola oil, etc.
Yes. Okay. Well, canola oil is oftentimes genetically modified, so you got to stay away from canola oil. But sunflower seeds, canola oils, vegetable oils, they're very high in something called omega-6 fatty acids. And omega-6 fatty acids increase inflammation. Now, as a chiropractor, my team of doctors and I have a goal is to get you well. And part of every condition you can come to us with, no matter what it is going to be an inflammatory component. So we got to get the inflammation down. So if you're going to do oils, I recommend something that isn't so high in omega-6 fatty acids like olive oil, coconut oils, avocado oils, almond oils. Those are better choices. Now, the seeds have fiber in them, and they have other nutrients in them. So when you eat the whole seed, you're going to get a lot more benefits. When you extract out the oil, you're concentrating down the oil. So think about how many sunflower seeds you'd have to eat to get a tablespoon of oil. A lot. Tablespoon of sunflower seed oil is really easy to use. So that's why if you're going to do oils, use them sparingly, but it is processed. The oils are still processed, and I'd rather eat closer to whole foods than processed foods. So the whole food would be the whole seed, and you're going to get a lot of nutrients, and you're going to have symbiotic relationships working with the whole seed. So does that make sense?
Sure.
Okay.
Got it. Thank you.
Great. Appreciate the call. If you have a question, folks, 844-44-Dr. Joe. All right, so we're talking about the food romance connection here. Gosh, this show flies by, man. This is amazing how quick it's going. So if you have questions, get them in right now, 844-44-Dr. Joe. So let's talk about some other reasons why romance may not be in your future. Ever, maybe. Fatigue. How many people are tired all the time? Raise your hands. Sure, absolutely. It takes a little energy to have a little romance, doesn't it? And so what's happening is if you're tired all the time, that's not fun. And if you're tired all the time, it could be an adrenal problem. If you have bags under your eyes, if you're tired all the time, if you drink a lot of stimulants, coffees, chocolates, teas, if you're stressed out. How many people are stressed out? Raise your hands. Too tired, stressed, raise your hands, right? So if you're stressed out, the adrenal glands produce adrenaline, but they kind of get burned out. The adrenal glands also produce something called prostaglandins that control inflammation. And the adrenal glands also produce something called pregnenolone, which becomes DHEA, which becomes testosterone, or all your sex hormones. If you're under stress, the DHEA is not becoming a sex hormone, it's becoming cortisol. Cortisol causes you to lay down fat, and when you're laying down fat and you're stressed out, you're not producing the right hormones. So many times when patients come to us, if we have to try to balance out their hormones, we look at their adrenal glands. Now, one supplement I take every single day is Dr. Joe's Adrenal Support. And I take that every day. I take nitric oxide, which opens up the blood vessels. I take Super Greens and Essential Source. More on nitric oxide coming up, so hang on to that thought. Super Greens and Essential Source. Vitamin D in the winter, absolutely positively necessary. You need 5,000 international units a day. That's only 5 drops of Dr. Joe's vitamin D. Super Greens and Essential Source, that's the minimum, folks. You just got to do that. There's no question. That's the starting point for everybody. And that's going to be key to getting your energy up and the adrenal glands. And then drink a lot of water. So many people just simply dehydrated. And when I get them drinking water, they get their energy back. And then chiropractic care. Because if you have pain, pain is exhausting. How many people can vouch for that? Everybody. So this is why it's really important. If you have neck pain, back pain, shoulder pain, if you've ever been in a car accident, ever, if the car was damaged, you were damaged. The sooner you get to see us after an accident, the better. So folks, go to my website, drjoe.com. You can set up an appointment there. Follow us on Facebook. Follow us on Instagram. Follow us on YouTube because we live stream a lot of our shows. All the supplements, all the information is going to be on our website, drjoe.com, plus over 1,000 hours of podcasts because we want to get you well and keep you well. Hey, tell your friends about the show. I'll be right back.
Okay. I didn't know if that was a wrap it up or if that was we got an endorsement coming up.
We were supposed to have an endorsement for him, but I think he snuck it in before.
Okay, got it. Okay.
I'm liking the music today.
Well, he's got this good, sexy music, man. Little Marvin Gaye.
Tina said that it'd be a different story if you had to walk up and down those stairs all day.
For energy? Come on, Tina. Bring it on, baby. I'm ready for you. It just popped up there. I don't know what it was. Okay. I'll trade jobs, Tina. When do you want to trade jobs? Come on, I'm ready for you. Tina's one of our workers, so I'm just playing with Tina here. So.
About how many hours of sleep should you get a night?
7 to 8. Find out what works best for you. Minimum of 6, though. But 6 to 8 is you got to find out what works for you. I'm usually about a 7, 7.5. Last night was 8, which was really surprising to me. But usually 6, 7, 7.5 is where I'm good. What else? Just making a note. Okay, good. Okay. Okay.
A little off topic, but my toddler is at the stage where she survives off of air.
Yes.
She eats well when she's hungry or snacks on what you consider garbage.
Yes.
If it was your kid, would you let her wait until she asked to eat about once or twice a day? so she eats well, or would you feed her for calories?
Nope. Let her. She'll come around. I promise you. Kids go through all these cycles, and no matter what it is with kids, it's going to change. I promise you that. So if it's good, it's going to change. If it's bad, it's going to change. So right now, only have good food in the house. Don't leave the garbage in the house. So if you have a bowl of fruits and vegetables out on maybe some nuts out there, whatever she likes, just leave it around the house. I promise you, she's not going to starve. The kid will come around. They always do. So don't feed them the junk food. No, she doesn't need the calories. When she's hungry, she'll eat. She'll be fine.
My phases were from microwave pizzas to microwave pancakes to microwave meals to microwave other meals.
Yep.
I was horrible.
Yeah.
Grilled cheese and chicken tenders.
Oh yeah, I ate nothing but grilled cheese for like at least 2 years.
Uh-huh.
And funny story, my dad wasn't paying attention.
Uh-huh.
I think I was probably 7 years old, and I ate nothing but grilled cheese for a solid 2 weeks. Literally nothing else.
And you're alive to talk about it. That's amazing.
Yeah. And we're driving to Myrtle Beach, and I kept on passing gas. Turns out I hadn't used the restroom in several days, so my dad decides to put me out of the car. Says, "All right, you're done. You're out." Puts me out of the car on the side of the road. I'm 7 years old. Drove off.
Oh!
Actually drove off.
That'll cause trauma.
Turned around in the interstate, came back and picked me up. This was a different time.
Oh, yes.
But came back, picked me up. I was bawling, crying, and I couldn't help it.
Sure.
So we finally get to the restaurant that we're driving all the way to get to, and the girl that we're meeting there is asking why I'm crying. So he explains it. Of
course, yeah, embarrassed and sad, right? Yeah.
And she immediately jumped up, went and bought me some laxatives, came back, and there you go.
Everything worked out for the best, let's say, yes. Yeah, because I mean, bread and cheese, there's no fiber there. I mean, there's nothing going to move. That forms a ball. It's called a bolus in your gut. Nothing moves through. So, yeah. Now you're better.
Yes.
Brought you around. Santa Maria, the things I got to do for this kid.
About 20 years.
Yeah.
Yeah, 20 years of trauma this has been.
Yeah, right. I know. Hey, do we need to talk more? How does that make you feel?
Okay, so some questions about anxiety.
Yes.
On track with...
yes, with you. I'm listening.
I had a couple of bad panic attacks in recent years.
Yes.
That sent me to ER.
Yes.
To the ER. I was on Lexapro for a while, but asked PCP if I could come off, and she said yes. I now only take Xanax when I feel anxiety coming on, like a choking feeling. Any vegan or natural suggestions to help cope with anxiety?
Yes, got to look at the digestive system, and we talk about this a lot. I've never had a patient with anxiety, depression, bipolar, ADD, ADHD, ever in my 35 years of doing this that didn't have his stomach up against the diaphragm. And when the stomach pushes up against the diaphragm, the stomach can't break proteins into amino acids, and amino acid tryptophan becomes serotonin, and tyrosine becomes dopamine, and glutamine becomes GABA. And so you got to get the digestive system working whenever there's a panic attack. Because if you're not absorbing your nutrients properly, or if you have pain, if you have pinched nerves, that can cause panic attacks as well, the body goes into survival mode. So we got to check the nervous system, we got to check your digestive system, we got to check your diet, and in most cases, in fact, I've never had anyone not respond amazingly. You might be the first one not responding, but I doubt it. So. What else we got?
My boyfriend is awesome, but when he eats vegan with me, he has gas and lots of it.
Yes.
Why?
Digestive enzymes. Meat eaters have different bacteria in their colon than vegetarians or vegans. And so what we have to do then is get him on some digestive enzymes, and let's see if we can recolonate his colon with good bacteria. That's going to be a key there. Because, yeah, once you change your diet, your bacteria, and what's called the flora, will actually change. So there is a transition period there. So Dr. Joe's Digestive Enzymes, Super Greens, an essential source, and let's see if that helps. Probably will. Yes?
You looking something up? Okay, we'll go back to this question from...
Okay, go ahead.
Are there conductors of the brain's electricity other than the nerves that can help improve...
Oh, that's right. Yeah, okay. So the way the nerves work is you have sodium and potassium on the inside and outside of the nerves. And when they go back and forth, they create what's called an action potential, and that's a nerve impulse. So you have to have the proper sodium and potassium moving in and out of the nervous system in order to create an action potential to create the nerve work. So the nerves carry everything. There's meridians if we want to get into acupuncture and Chinese medicine, but we're not exactly sure how they work. We know they're there, we just don't know how they work yet. So making sure you have a good diet is going to be key to make sure the nervous system is working properly, also working with the meridians then. So make sure the nerves work, that's going to be the key. So. And you do that by chiropractic care, good diet, supplements, everything we talk about. Mr. G, anything happening over on your end?
Just some research.
Okay. He's busy over there. Sierra, any of your friends?
No more questions from them. I think that.
Okay, that's fine.
I've gotten all of them.
And folks, make sure you share this information with all your social media, whatever you're on. So share it everywhere. We want to get up to the high levels so that we can get better placement on YouTube, on Instagram, so that more people can get this information. I need your help. Here we go.
Depend on it. Does this sound like you? Neck pain, back pain, shoulder pain, headaches? Chances are you'd benefit from chiropractic care. Chiropractic care, because chiropractic care tries to get to the cause of your problems and not just cover up the symptoms. If you're ready to get well, I want you to go to my website, drjoe.com, or call 844-44-DR-JOE and make an appointment for you, your friends, and your family today. We have offices in Marietta, Duluth, and Stockbridge. Make an appointment today so we can help get you well and keep you well.
You'll ask yourself, why didn't I listen to him sooner? Dr. Joe Esposito on News 95.5 and AM 750 WSB.
Hey folks, Dr. Joe here. So glad you're there because we're talking today about the food romance connection. And we have 2 more segments here of the show. So if you have any questions, 844-44-DR-JOE. We've got a lot to cover here. But if you have a question, give us a call, 844-44-DR-JOE. That number rings through to my offices when I'm not on the air. So you can make appointments to come see us. Because the biggest complaint I get is what? Why didn't I do this sooner? Ahmad's even mouthing it with me here, so he's heard it more than once. How many years we've been together now, Ahmad? 7,
honestly,
8?
I've lost count. Yeah, it's a lot.
It's a long time. I mean, I count them by Super Bowls. When we go to Super
That's
Bowl,
true.
right?
That's a good idea.
That's how we know. Now we've been together a long time. So, so let's talk about some things, reasons why we may not be in a good mood, a romantic mood. We talked about fatigue, stress. We talked about that. The cortisol that's released when you're in that mode, you get in a sympathetic mode. Romance is a parasympathetic function. You have to be relaxed. Nerve damage or pinched nerve. This is a biggie that no one seems to pay attention to. So what happens is if you have a pinched nerve in the low back, you might have back pain, leg pain, hip pain, knee pain, ankle pain. But that same nerve in the low back controls your colon, your sex organs, and your bladder. So a pinched nerve in the low back, you might have things like gas, bloating, diarrhea, constipation, urinary problems, and sexual problems. Because the nerve in the low back controls the reproductive organs. So if we have a pinched nerve down there, and I've had this happen so many times in my career, where patients come into us and they have these issues, men and women, and we adjust the low back and we put the bones back in place. Their low back feels better, their leg pain gets better, but suddenly their organs start working again. Doc, it works. Oh my God, it's amazing. So it's something you might want to consider. That's something that's so overlooked in healthcare, but it's changing right now. A lot of big hospitals in the area, one of the big physical therapy clinics, I'm going to probably talk about them if we join forces together. Neurology clinics, they're all coming and saying, Dr. Joe, we've never heard this before. This is all new to us. And it makes sense. And that's the key. I love when a patient says that, those three, I always say when a girl whispers those 3 little words in my ear, that makes sense. I love it because when you understand why things happen, it's a lot easier to deal with them. So getting out of the stress is important. Is chemical stress, physical stress, and emotional stress. And you can fix the chemical. I teach you how to do that. Take supplements like Super Greens, Essential Source, Nitric Oxide to open up the blood vessels. The physical stress, my team of doctors can help with that. And then that's going to make the emotional stress a whole lot easier to deal with. But damaged nerves and pinched nerves are a biggie when it comes to romantic, all functions actually. And this is where chiropractic care comes in. And most people wouldn't think to go to a chiropractor until they listen to the show and go, oh gosh, I didn't realize the nerve to my lungs could be being pinched. I may have asthma. Nerve in my low back may be pinched. My romantic organs. My nerve to my stomach might be pinched, affecting my digestion. So every organ is hardwired to the brain by way of a nerve. And if you pinch that nerve, it's going to affect the function of the organs that's on the other end of that nerve. Drugs. Folks, you got to realize that maybe there's an issue because you're taking medication. If you're taking medication, look up the side effects. We have the internet now. You can look up anything. So look up the side effects of your medications and see if one of the side effects might be a lack of libido. Because if it is, that might be something you want to look into. Infections. Sometimes folks have infections, low-grade infections. Sometimes they're subclinical. You don't know they're there. And you have to get that taken care of. And one of the things we talk about, so important to keep the immune system strong, is sugar. You got to get the sugar out of your system, folks. Is it hard to do? Yes. At the seminar yesterday with a friend of mine, known him for 35 years, and he's lost like 35 pounds. And I said, oh my gosh, what happened to you? He goes, he says, me and the wife finally decided we're done. We can't do this anymore. So he gave up the alcohol, and he gave up, he's going on like kind of like a ketogenic type diet. And we talked. He says, "What's your thoughts on it?" He calls me Espo for Esposito. Espo, yeah, Espo, what's your thoughts on that? And I said, "Well, you really got to cut back. You can only cycle in and out of the ketogenic diet. You don't want to do it forever." He goes, "No." He says, "Once I get down to my weight," he says, "about 5 more pounds." He goes, "Once I'm there, then I'll go back again." And he says, "Yeah, the wife told me I got to give up the beer." And I said, "Yeah, you got to give up the beer." So the alcohol is a big player in putting weight on, of course, but you got to make sure that you're eating the good foods. And he is. He's doing a good job with it, and he's losing weight. And he says more energy. He goes, "Oh, God, I feel great." So it really does make a difference. Body odors, that can be a reason why someone doesn't want to get close to you. So you might want to consider showering. It's good. We talked about if you have bad breath, because that's certainly a turnoff. There's 2 types. It could be an infected tooth. It could be coming from the bowels. And if you have that potty breath, then it's a digestive issues. You might want to come see us. We can pull the stomach away from the diaphragm, check the nerves to the stomach, get you on a lot good digestive enzymes like Dr. Joe Super Greens, Dr. Joe's Essential Source, Dr. Joe's Digestive Enzymes, get you on a more raw food diet. And in most cases, that's really easy to fix. It usually goes away pretty quickly. And very soon, we're going to have Dr. Joe's intestinal formula, which is going to help clean out the colon. And that's coming in a few weeks. We had to get it ordered, make sure we had the right products there. So all right. So if you have any questions, 844-44-Dr. Let me talk about nitric oxide real quick, because a lot of people send in questions about nitric oxide. Nitric oxide is a chemical in your blood vessels, and it opens up the blood vessels and allows circulation. Now, medicine figured out how to do this, and they made little blue pills for men, and they work. They work very well. They open up the blood vessels. However, the damage is that with the little blue pills, it can be too much. And if you have too much all at once, that can cause problems with the brain function and can cause real serious issues. So when it comes to the little blue pills, a lot of people have side effects. And you read the commercial, you listen to the commercials, right? If it lasts more than 4 hours, see a doctor. Well, yeah, because that can be a real serious issue and can cause damage to the reproductive organs, to the tissues, because they have to have circulating blood. They can't have stagnant blood, and that can cause some real serious issues. We don't want that happening. So nitric oxide is a more natural way to get the blood flow going, and it's on our website, drjoe.com. And I tell people, start out with 1, see how you do, then take 2 the next day, 3 the next day, 4 the next day. If you're okay, 4 is the dosage that I recommend, but you can build up to it. I can't take them at night. If I take them at night, I'm too wired. I have too much energy. So one of the things we talked about when it comes to romance is energy, and so you might want to consider Dr. Joe Super Greens, Essential Source, adrenal support, nitric oxide, and a lot of water, going to a more plant-based diet, and you're going to have more energy to know what to do with, and people are going to find you annoying. So that I would add. We're going to cover now what can you eat, what are actual real aphrodisiacs, and nitric oxide might be something you might want to consider. The adrenal support as well, because that helps produce the sex hormones. Let's talk about some foods you can eat, because, this segment's go so fast. Okay, asparagus and cucumbers. They're high in vitamin E and phosphorus, which can help increase hormone production. Anything you build in your body, you have to have the raw materials. And you get the raw materials from eating a good diet and taking the right supplements. Hot peppers, spicy food. Spicy foods are vasodilators, so you have more blood and oxygen to your organs. So you talk about a hot summer night, as Meatloaf talked about on the Bat Out of Hell album. It was, who did that for? Yeah, that was Meatloaf. Okay. Now I was trying to think who did the voices, but it was him. Hot summer night. Vasodilator opens up your blood vessels, so you can get a spicy romantic evening from actually having spicy foods. Just be careful if it causes digestive problems, of course. But spicy foods are very good because they open up the blood vessels. Avocados, artichokes, they're high in essential fatty acids, which can help produce more testosterone. Once again, you need the raw materials to produce the testosterone. So artichokes can be good. Now, be careful. Artichokes can be a little gassy for some folks, so you might want to be careful with that one, especially for a romantic evening. Celery, spinach, and figs. What odd combination. They alkalize the system. They're loaded with minerals, and the body needs minerals to neutralize acids. And if you're eating a typical diet of alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, you need to neutralize those acids. What's a great thing to neutralize it with? Dr. Joe's Super Greens, Dr. Joe's Essential Source. Very alkalizing to the system. But celery, spinach, and figs are excellent when it comes to that, too. Folks, got a lot more things to talk about on what you can eat, some exotic foods. And then if we have time, we're going to talk about what is an erogenous zone, how to find them, and what to do with them. Hey, folks, I'm Dr. Joe Esposito. The website, drjoe.com. The numbers here, 844-44-Dr.Joe. Not sure if I'm going to have time to get to any more questions. But if you have a question I didn't get to you, go to my website and send it to me, drjoe.com. And if you want to make an appointment to come see us, we're going to tell you how to do that in just a second. I'm Dr. Joe Esposito. We'll be right back.
You're like
Like most people, you have neck pain, back pain, shoulder pain, numbness, tingling, headaches. Maybe it's time to stop suffering and it's time to take action. If you're sick and tired of being sick and tired, why don't you come see me and my team of doctors and let's see if you have a problem so we can help. Go to my website, drjoe.com, or call 844-44-Dr.Joe to make an appointment today because so many of you are out there suffering needlessly and we want to put a stop to that. Come see us at our offices in Marietta, Stockbridge, and Duluth. Make an appointment today so we can help get you well and keep you well.
Are you experiencing hot
I'm here, so I can't be there.
Do you suffer from sleepless nights?
Just check it out, Garrett. That's all. All right, last chance for some questions. Go ahead.
You have any questions?
You have any
I
questions?
have nothing right now. What is a good source of vitamin B12?
Nutritional yeast and Dr. Joe's B complex and Dr. Joe's essential source. So that's where I get my B12 as a vegan. That's where I get my B12. So make sure the nutritional yeast is fortified with B12. Otherwise, it doesn't have it in there. So yes.
Interesting.
Okay.
One day I'd love to be able to mention that brand.
That brand?
That brand.
Of
Okay.
nutritional yeast?
Yeah.
Okay.
I'm gonna reach out to
To
them.
have them sponsor, that would be great.
Yeah.
I love their stuff.
Uh-huh.
Okay, please explain how being on a vegan diet can improve the body's natural scent from both skin and all areas. And then they went on to say, I once had an Indian yoga teacher require all of his students to shower before class, but he stopped me from showering because he said I didn't have the same scent because I don't eat meat.
Oh, absolutely. Yeah. No, there's definitely a difference. And when it comes to romance too, I've heard that too for all aspects for men and women. Breath and other body odors and body smells and tastes is definitely a difference between vegans and non-vegans. I've heard that many times. So, yeah. So it does work because the food rots in the colon, and when meat is digested, it breaks down to uric acid. Uric acid gets into joints and it hurts. Ammonia is produced with dead carcass. That can come out of the skin as well. So even the Indian instructor knew that. If you don't eat meat, the body didn't have that smell. So.
And what can help with brain fog?
Supergreens, essential source, nitric oxide, B complex, plant-based diet, chiropractic care to open up the nerve supply into the brain. If you have acid reflux or heartburn, pulling the stomach away from the diaphragm so you can digest your food more efficiently. How's that for a few to start?
I know for me, nitric oxide helps a lot when I'm feeling very sluggish.
Yeah, the nitric oxide is pretty cool. Do you have an empty bottle here?
One of them is nitric oxide.
Was it? It's
The
a bigger
biggest
bottle.
one.
There you go. Ta-da! There you go. That's the magic right there. Well, they're all magic. Every supplement here is like magical. Everybody has a story to tell about how great it is.
So I can
Oh, by the way,
cigarette before we go inside.
where'd that come from?
Decided it needed to be heard.
I guess so, yeah. And by the way, folks, if you like us, give us a good review on Google. Give us a Google review. Maybe give us a, I can't tell you what to give us, but it'd be nice to give us some good reviews. And because again, I want to spread the word, and I need you guys to help us spread the word. So if you're listening, obviously, I hope you're a fan, and I want you to get passionate like we do, and you want to spread the word. So Google reviews, share this, share all your links with your other social media and on your social media that you're watching on right now. So help us get to be the ones that everyone turns to for healthcare advice.
And if you don't do it for this guy, at least do it for me.
You do it for Garrett because he wants a raise.
It makes my job easier, makes me look better.
That's true. So do it for Garrett. There you go. Because if we're getting good reviews and everything, that means Garrett, my marketing director, is doing his job. So you could give Garrett a attaboy by doing that for him.
What do you think about grapefruit seed extract?
It's good. It's okay. No problem with it. Mm-hmm.
Grapefruit seed.
Grapefruit seed. I have some in my refrigerator right now, as a matter of fact.
Grapefruit seeds?
Yes. No, grapefruit seed extract. I have grapefruits on my counter, and they have seeds in them. Yes. So, more questions?
What else is in Dr. Joe's kitchen?
Nothing. No. I don't have my house. Well, you've been to my house. It's not a lot of stuff. I don't like a lot of stuff. I got a pantry full of food, though. I love having food. Growing up poor, we always had food. There was one thing that we had to share with the family was food. So my pantry's, oh, 1 minute. My pantry's loaded with food. My freezer's loaded with frozen vegetables, I think everywhere, and soups and pestos and ginger. My ginger tea is always in there in the winter. My refrigerator, not a whole lot. My refrigerator's kind of sparse, actually. My veggies, my almond milk. What else got in there? Vegan
We
cheeses.
just cleaned our fridge out and
Yeah, we got rid of all of those sauces that sit in your refrigerator door. For
Yes.
way too
everything
long.
we had that was like not vegan from the past.
Yeah.
Because you only clean your fridge out once every year.
Exactly. Out it goes.
And I was surprised. Like we went and spent almost $100 for groceries, and none of it went in the fridge.
Yeah.
We have like one drawer for produce, and like that's full.
Basically, just salad stuff is all
Yeah,
we have in
that's
the
it, yeah.
fridge.
That's all I got too. You got some coconut water in there. And
Yeah, we have some coconut water and coconut milk.
I have a can of beer. I don't know where it came from.
Probably Diuretic.
Naturally get well and stay well. Dr. Joe Esposito on WSB.
Hey folks, Dr. Joe here. We're talking today about the food romance connection, how food affects your love life. We only have a quick segment here, so I'll try to cover it all. If we didn't get to your questions, you can send it to me through the website, drjoe.com. If you want to make an appointment, which I think you should, because if you have neck pain, back pain, shoulder pain, if you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. You are not stronger than the steel in your car. So go to my website, make an appointment right away. The sooner you get to us, the better. And every time I say this, people will call and say, I was in an accident this weekend. I better go see Dr. Joe, because I want to make sure you get the quality, proper care. There's a lot of people out there that aren't giving the high-quality care that you need after an accident. Maybe they're just concerned about running up the bills. My concern is I want to help get you well, okay? So let's go to some quick foods. I want to talk about what an erogenous zone is, too. We talked about ginger. Ginger and ginkgo biloba, excellent for opening up the blood supply. Seminar I attended yesterday, one of the neurologists was talking about that, and they said the first thing they give with headaches is ginkgo biloba. I went, oh my gosh, haven't we come full circle here from nothing but drugs? Now we're going back to the herbs, which is great. Ginseng, Asian or Korean, increases sperm production and testosterone, so you might want to consider throwing a little ginseng into your diet. Water is very important. 8 glasses of water a day is probably a good idea, so you get good circulation. Raw fruits and vegetables, we talk about that. You have to get the enzymes into the body. You have to get the nutrients there. And, of course, super greens and essential source are probably the easiest, quickest, least expensive way to make that happen. Those, of course, are on the website, drjoe.com. Yohimbe. Yohimbe is a supplement you can take, and it's an aphrodisiac. There's also something called horny goat weed. And the reason that happened is because Russian farmers found that when goats would eat this certain thing on the side of this hill, they'd get a little frisky. And it turns out that's where it got its name from, and it actually is an aphrodisiac, which is true. And, of course, the whole food supplements have to just be part of your diet. So let me cover erogenous zones. We got about 5-6 minutes here. What an erogenous zone is, it's where the nerves and blood vessels are close to the skin. So you're more sensitive. So where might that be? The inside of your elbow. The nape of the neck is very erogenous, very nerve and vascular supplies. Your lips, of course. Your lips are tons of blood supply and nerve supply. That's why it's nice to be kissed. Your ears, the back of your knees is one you might want to consider too. Your hands, lots of nerve endings there. The scalp. So wherever there's a lot of nerve endings, you're going to find that it's very pleasant to have that area massaged or stimulated. Massage is nice. Massage can help the body go into the parasympathetic mode because we talked about romance. Sympathetic speeds you up. Parasympathetic nerves slow you down. And so if you're going to massage, I want you to massage the muscles that are controlled by parasympathetic nerves. How about your trapezius muscles, your shoulders? So when you massage the shoulders, you're stimulating the spinal accessory nerve, which is a parasympathetic nerve, and it helps kick you into that parasympathetic mode. So this is why you can get your shoulders rubbed. Ooh, I like that. That feels good. Hey, you get your calf rubbed. It's nice, but it's not a parasympathetic innervation. The trapezius muscle is probably the biggest one and the easiest one to access. So by stimulating the trapezius, it kicks into the parasympathetic nervous system, which is kind of cool. If you're going to use candles, let's talk about little things that can be sexy. Candles are nice, very romantic. However, be careful if they're scented. Because if they're scented, chances are they're scented with chemicals like parabens, which are endocrine disruptors. They act like estrogen. So you want to stay away from that. You want to go more toward natural candles. So if you're going to do candles, I recommend soy-based or beeswax-based. And if they're going to be scented, I want you to use essential oils, pure essential oils. Yang Yang, Y-A-N-G, Yang Yang is actually an aphrodisiac oil. So you might want to consider using that as well, which is kind of cool. Consider what the other person likes. You know, I mean, I don't know. Some women may not consider ESPN as a foreplay, you know. So if you like that and a woman does, that's great. But, you know, if you're going to get into that mode, you want to start to consider what the other person might enjoy. Music is nice. If you get a music that has a slow beat to it, like a heartbeat. There's a band called Enigma. I don't know if they're still around anymore, but very sensual music. And that's kind of cool stuff, too. But something gentle. The soundtrack to Somewhere in Time. I don't even like soundtracks, but there's something about that. It has such a rhythmic beat to it. It's just wonderful. I find that just be very relaxing. So try to find music that's very relaxing that you like. And if it's too stimulating, you may be kicking yourself into the sympathetic nervous system and not staying into the parasympathetic nervous system. Silk and satin. Why? Because it stimulates the whole body. And that's one of the things. Now, silk and satin sheets can be a little tricky. You might slide out of bed. I don't know, but that can be a little challenging. But anything that's going to stimulate the whole body, if it's warm enough, put the fan on. Breezes are really cool because they stimulate all the nervous system, which is kind of exciting, and that's nice. And then oils are nice too, but you got to make sure you're using the right kind of oil. If you're going to use an omega-6 fatty acid oil, like a sunflower seed oil or a vegetable oil or canola oil, not a good idea. Because the omega-6 fatty acids can increase inflammation, and inflammation can increase pain, and that can stimulate the sympathetic nervous system. So you want to use things like avocado oil. That might be a good choice, okay, which has the essential fatty acids in it. That would be a much better choice. Be careful with things like castor oil. That can be detoxifying to the body, and that may not be something you want to put in there. But you got to start to figure out what works for you and whoever you're going to be with. And that's kind of important. And lighting is important. You can lower the lights. You know, one of my friends says, what's the best form of birth control after 50? He calls it lights. Because nobody wants to come near you. That's Tim's joke. Sorry, Tim, if you're listening, there's your joke there. I forget to throw it in there for you. But doing the right thing is so important, and not just for romance. And, of course, we do this show, and everybody kind of has a tongue-in-cheek response to it, but a lot of good information here. So if you want to hear the show again, you go to my website, drjoe.com, and we have over 1,000 hours of podcast there. But the key here is getting the nervous system working. Gosh, sounds like every other show we ever did. The nervous system working, the digestive system working, and good nutrition. So if your stomach is pushed up against your diaphragm, you have acid reflux, heartburn, burping, gas, bloating, you're not breaking proteins into amino acids properly, and amino acids become the neurotransmitters, and the neurotransmitters are the chemical that make your body work, makes your brain work, makes your nervous system work. And when it comes to romance, what do we say it is? It's all about nervous system and circulation. You have to have nerve supply and good blood supply to make things work. And you do that by making sure there's no pinched nerves. If you have neck pain, back pain, shoulder pain, numbness, tingling, you have a pinched nerve. Pretty clear. I mean, something's irritating the nerve. If you don't, that doesn't mean you don't have a pinched nerve, because 90% of the nerves in your body don't feel pain. So you can have a pinched nerve and not know it. So you want to get that fixed. This is where chiropractic comes in. It relieves the pain in most cases, but also opens up the nerve supply to the organs. From a nutrition standpoint, again, digestion, very exhausting to the body. So eating light is going to give you a lot of energy. When I do a show, I stop eating about 4 hours before the show, because I know when I come on the air, I want to make sure I have my energy levels up. Supplement-wise, absolutely. Dr. Joe's Super Greens and Dr. Joe's Essential Source, the minimum amount of nutrients you need every day. When it comes to romance, nitric oxide opens up the blood vessels. You got to get vitamin D in your body in the winter, because you got to keep the vitamin D levels up to keep the immune system strong. You got to drink lots of water. That's going to help with circulation. And so it's not hard to get well. Oh, you got some Enigma playing for me. Look at a mod there. So it's the key here is get the nervous system working, the digestive system working, and good nutrition. It's not hard. It's pretty easy as long as you know how. And if you want to learn more, go to my website, drjoe.com. Over 1,000 hours of podcast there. If you want to order supplements on the website as well. And if you want to make an appointment, 844-44-Dr. or on the website, drjoe.com. We have offices in the Atlanta area, Marietta, Duluth, and Stockbridge. I'm Dr. Joe Esposito. Tell your friends about the show. Catch you next time.
Hey, it's Belinda. I used to think about making tweaks to my appearance all the time. Finally, I visited Marietta Plastic Surgery. Now, I only wish I'd done it sooner. Doctors Hannah, McNeil, and West are all board certified by the American Board of Plastic Surgery. And the newest addition, Dr. Patel, is board eligible. They offer a